Hello, dear students. Can you hear me? Hello, dear students. Okay, perfect. All right. Audio is clear. Video is clear. Everybody, shall we start? Shall we start then? Yes. So, right. Welcome to pathology. Now, before getting into pathology, hope my let me confirm. मेरा आवाज ठीक आ रहा है? हाँ, ठीक है, सब बढ़िया। तो चलिए शुरू करते हैं। गुड इवनिंग एवरीवन। सो वी आर गेटिंग वेरी क्लोज टू एग्जाम। ठीक है, तो एग्जाम पास आते आते थोड़ा डर ज्यादा लगेगा, इट्स टोटली फाइन। ठीक है, तो इट इज नॉट समथिंग यू हैव टू बी स्केयर्ड ऑफ। मतलब यार डर लग रहा है तो क्या करें, डर लग रहा है तो लगेगा, इसमें कोई गलत बात नहीं है, बट उसको आगे मतलब यू हैव टू हैंडल दैट एंड गो फर्दर। तो गुड इवनिंग। तो चलिए शुरू करते हैं पैथोलॉजी। राइट, सो व्हेन वी वांट टू डिस्कस पैथोलॉजी, माय डियर स्टूडेंट्स, पैथोलॉजी के अंदर मैं आप लोगों को एक टेक्निक बताता हूँ, मेरा बात अच्छे से ध्यान से सुन लो। ठीक है, तो क्या है ये टेक्निक? सो द टेक्निक इज वेरी सिंपल डियर स्टूडेंट्स। तो आप लोगों को ना पूरे पैथोलॉजी में ना, व्हेन एवर यू आर ट्राइंग टू लर्न एनीथिंग फ्रॉम पैथोलॉजी, रिमेंबर वन सिंपल रूल विच आई एम गोइंग टू टेल यू। देखो, इसमें ना एक जनरलाइज स्टेटमेंट्स बनाओ। ओके, मतलब एक्सेप्ट फॉर द डिसीजेस इन द जनरल पैथोलॉजी, मेक ए जनरलाइज स्टेटमेंट एंड उसी हिसाब से पढ़ने लगो। ठीक है, तो दैट इज गोइंग टू हेल्प यू। ठीक है, खरा शो शुरू करें। ऑलराइट। So first, I will tell you the importance of pathology. So there will be around 12 to 15 questions. Sometimes it might go up to 17 questions. So 17 क्वेश्चन में से हम लोगों का मतलब मार्क स्कोरिंग पॉइंट क्या होगा, क्या करें। तो इसका सिंपल पॉइंट है, तो इन दिस वेरी सिंपलेस्ट एस्पेक्ट इज दैट आपका नोट्स जहां से भी पढ़े हो, इरेस्पेक्टिव ऑफ दैट, ठीक है, तो आपका नोट्स में ये क्वेश्चन आएंगे। ठीक है सर, ये रिवीजन से हमें क्या फायदा होगा? तो रिवीजन से तुम्हें ये फायदा होगा कि मतलब आई एम गोइंग टू रिवाइज ओनली दोस कंटेंट विच इज वेरी इंपॉर्टेंट फॉर द एग्जाम। ठीक है, तो मुझे पैथो पढ़ाने लग जाऊंगा तो मैं पूरा सब्जेक्ट भी पढ़ा सकता हूँ, दैट इज नॉट द पॉइंट हियर। द पॉइंट हियर इज दैट टू मेक योर लाइफ इजियर। ठीक है, तो उस रेस्पॉन्सिबिलिटी लेके मैं यहाँ पे बैठा। ठीक है, सो आई एम वेरी सीरियस अबाउट इट। नाउ व्हेन आई एम टॉकिंग अबाउट पैथोलॉजी इन दिस, तो आप लोगों को सर कौन सी सिस्टम पे ध्यान दे? ठीक है, सो यस यस, नो प्रॉब्लम। सी, यू आर गोइंग टू फोकस ऑन दीस सिस्टम्स। द मोस्ट इंपॉर्टेंट वन इज योर जनरल पैथोलॉजी। Okay, so why am I telling general pathology? Because general pathology is such a content where every time there are few fixed concept, the questions will be asked. Okay, and they're very frank and straightforward question. They're not going to be twisted and all. Okay, so that is the first advantage. Second thing is that, see, I will tell you, the second thing is make your hematology very strong. So the any question related to blood system, keep it very strong. Okay, so for example, some students come up to me in this last 2 days 3 days of the time, okay, and ask me, sir, I haven't studied the pathology, what am I supposed to do? So do not get scared in this time also. Now what you are supposed to do is that you are going to leave pathology and go to exam. Instead of doing that, just follow what I'm telling you. What I'm going to tell you is that focus on general pathology, hematology, two major things. Okay, so those are the two major chunk of pathology I can say for the exam point of view. Why? Because hematology serve you that straightforward question. Okay, type of straightforward question, and hematology, it will give you one more extra advantage is that it will help you solve the questions from medicine. Okay, so with that much being said, let's go to the adaptation. What is meant by adaptation? So in the general pathology, the first chapter is always adaptation. So what is adaptation? Adaptation is nothing but, see, for example, you go to a gym, right? When you go to gym, you are going to work out. When you are working out, you are putting stress on your muscle. Now what will happen is that muscles will start to grow. So how exactly your body will respond to stress is only your adaptation. Keep this in mind. How your body responds to stress is only adaptation. So in that we have hypertrophy, hyperplasia, right? Atrophy, metaplasia. Among which, see, hypertrophy, all of you know what is hypertrophy? Increase in cell size. Very good. Increase in the cell size. So if there is an increase in the cell size, the MCQ, what they will ask you is that what is the mechanism of action of hypertrophy? How does hypertrophy occur? Hypertrophy occurs as a result of increase of structural proteins. Increase of structural proteins. This is a very important question. Okay, so if I were the examiner, if I want to ask a question, all of you will study the first point as increase in cell size. Okay, let's go to the next one. No, I'll ask you this question: how does cell size will increase? By increase of structural proteins in the cell. Okay, now the next important aspect is that, see, all of you know that physiological scenarios for hypertrophy. All of you know the physiological scenarios for hypertrophy. For example, left ventricular hypertrophy in an athlete. I'm not just telling any generalized left ventricular hypertrophy, but left ventricular hypertrophy in an athlete. So that time it is a physiological. But I'm interested in pathological case of hypertrophy. So what do I mean by pathological hypertrophy? So what is that? Left ventricular hypertrophy, for example. Okay, left ventricular hypertrophy in the patient with hypertension. Patient with hypertension. Anywhere if there is an increase in the cell size, that is your hypertrophy. There, what is going to happen? That is your LVH in the patients with hypertension. Now everybody will ask, sir, any organ if it is used more, will it undergo hypertrophy? Yes, I can say that, but that concept is not usually applicable for your places like blood vessels sometimes. Okay, now let's get into the next concept. What is that? Hyperplasia. Hyperplasia is a very, very important aspect where there is an increase in the cell number, cell number. If there is an increase in the cell number, the most important question is that, so if anybody is increasing the cell number, if anything triggers the cell replication, will lead to hyperplasia. So the classic example for pathological hyperplasia, which is MCQ based, are these two things. So what is that? Endometrial hyperplasia. What is that? Endometrial hyperplasia. Endometrial hyperplasia. So endometrial hyperplasia, when will it occur? It is very simple. Anywhere if there is a more number of endometrial cells, means with exposure to, as a result of increase of estrogen. Increase estrogen will increase the cell number in the endometrium. That is a very important MCQ to be remembered. And the second one is benign prostatic hyperplasia. Benign prostatic hyperplasia. This occurs as a result of, all of you know from surgery, which I have already taught you, it occurs as a result of 1,5 dihydroxytestosterone. BPH will occur. So BPH means benign prostatic hyperplasia, which will occur as a result of 1,5 dihydroxytestosterone. These two are the diseases in which you can encounter clearly what is that? Hyperplasia. Okay, now physiological scenario for hyperplasia is, for example, smooth muscles of your uterus during the pregnancy. Okay, then let's get to the next important aspect, atrophy. So atrophy, what happens is that a decrease of cell size, or there is a decrease of cell number. Both of these case scenarios, we call it as a atrophy. So atrophy, what happens is that there is a shrinkage of the organ. What is that? Shrinkage of the organ. This is a very important point to be remembered. So can you tell me an example for an atrophy? Yes, we have what is called as, for example, senile atrophy. What is that called as? Senile atrophy. What is this senile atrophy? Senile atrophy of the brain. Okay, so in old age, as age progresses, what will happen is that atrophy of the brain cortex will occur. Then we have very good answer, that is your thymus gland is there. With age, the size of the thymus will go down. And the next important aspect is that Alzheimer disease. In Alzheimer disease also, there is a shrinkage of the brain. So Alzheimer, there are important points to be remembered. There is a beta amyloid. There is a deposition of beta amyloid. Okay, point number one. Point number two, you can find neurofibrillary tangles. And also you are going to find one more thing, that is only called as a tau protein. What is that? Tau protein. Okay, so these are the three important MCQs which can be asked from the pathological side of your, that is your Alzheimer disease. So these are the most important points related to your atrophy. Let's talk about the metaplasia. Now, when I'm talking about a metaplasia, my dear students, remember metaplasia is what? Metaplasia is a change of phenotype. What do I mean by change of phenotype? Change of phenotype means, so all of you know that physical appearance itself has been changed. Phenotype is nothing but physical appearance. Now the problem is that, so till now we studied a change of epithelium. Yes, of course, for metaplasia we have two types. One of them is called as connective tissue metaplasia. Connective tissue metaplasia. If connective tissue metaplasia is there, now if there is a connective tissue metaplasia, can you call it as a epithelial metaplasia? No, right? So basically, change of one cell to another cell is metaplasia. You're right. Okay, but is it only occurring in where? Occurring in your connective tissue? No, it is also occurring in the epithelial cells. So the classic example for your connective tissue metaplasia, my dear students, remember Barrett esophagus is correct. But before going to that connective tissue metaplasia, remember this point. The classic example is myositis ossificans. Myositis ossificans. What happens here is that in the bone, fracture will occur. As a result of fracture, that will injure the muscle. First fracture will damage the muscle. Because of that muscle damage, later in the muscle, yes, what you are going to find is that calcium deposits in muscle. Calcium deposits in the muscle is called as myositis ossificans. It is seen with classically, it is a complication of supracondylar fracture. Supracondylar fracture of the humerus. So this is a very, very important point which has been asked. So what is this? There is a question is going to come. A child was brought to the hospital with the complaints of supracondylar fracture of humerus. After a year of the fracture treatment, there is a limitation of the movement in the arm. So because of this, on the X-ray revealed bone-like appearance in the muscle, or if they give you X-ray and previous history of your what is that supracondylar fracture, close your eyes and mark the answer as myositis ossificans. This is a very important MCQ to be remembered. Okay. Then we have one more metaplasia. Very good. That is your epithelial metaplasia. Epithelial metaplasia. The classic example, one of them is your in the lungs. In the lungs, what happens? Smokers will be there, right? So in the smokers, what will happen is that, so in the lungs, which epithelium is there in the lungs? Very good. Tell me. Very good. Which is that? Ciliated epithelium. Now, ciliated epithelium is changed into squamous epithelium. Ciliated epithelium changed to squamous epithelium. Okay. Epithelium is called as your squamous metaplasia. See, if any new epithelium, here what is a new epithelium coming? New epithelium which is coming? Yes, I'll repeat the same thing in Hindi, don't worry. So कौन सी नया epithelium आ रहा है? Squamous epithelium. Which is coming? Squamous epithelium. If squamous is coming, very good. So what I'm telling, if squamous epithelium is coming, so automatically in the smoker's lungs we have squamous metaplasia. So what do I mean by this? Whatever new epithelium is coming, that is the name of the metaplasia. Squamous metaplasia. Got it, everybody? Squamous metaplasia. Okay. So followed by that, let's get into the next important aspect. What is that? That is your columnar metaplasia. Columnar metaplasia. Where will it occur, my dear students? Remember, columnar metaplasia, the classic example is the Barrett esophagus. Barrett's esophagus. Now, when we are talking about a Barrett's esophagus, all of you know that what type of a metaplasia it is? Intestinal columnar metaplasia. Intestinal columnar metaplasia. So if there is an intestinal columnar metaplasia, means in the lower esophagus, squamous epithelium is replaced by your columnar epithelium. The most important MCQ here is that, so you can find goblet cells here. What is that you are going to find? Goblet cells. And what is the stain we are going to use? The name of the stain is called as Alcian blue. Alcian blue stain. Okay. So this is the story of your what is that? Metaplasia. Now followed by that, let's get to the next concept. cell injury. Now, when we are talking about a cell injury, my dear, cell injury can be divided into two types: reversible and irreversible cell injury. Reversible and irreversible cell injury. When we are talking about a reversible cell injury, what happens is that all of you remember this very basic concept. What is that? So, cell will suffer hypoxia. Now, depending on the severity of the hypoxia, how severe is hypoxia? Okay, if the hypoxia is very severe, it might go to irreversible cell injury. But if there is a hypoxia, what is going to happen? If there is a hypoxia, there is a decrease of ATP. If there is a decrease of ATP in the cell, there will be failure of sodium, potassium, ATPase, sodium potassium ATPase. If sodium potassium ATPase fails, what will happen? You consider this is a cell. Guys, just give me 1 second. There is a disturbance coming up. Just let me close the doors and all. So there is some festival. This thing is going on. Just give me a minute. I'm really sorry for the disturbance. I'm back here. Hope I'm audible. Just let me check the audio. Okay, fine, perfect. Okay, so what will happen is that sodium potassium ATPase will fail because of that increase of sodium in the cell. Increase of what? Sodium in the cell. If there is an increase of sodium in the cell, automatically it will increase the water in the cell. If there is an increase of water in the cell, remember what will be there. One of the most important concept is that so you will have cell swelling. Cell swelling, okay, followed by cell swelling, means more water will come, cell will swell up. Okay, yeah, apart from the cell swelling, what will happen? Loss of microvilli. Loss of what? Microvilli. Loss of microvilli means there is a small finger like projection on every cell. That finger like projections will be lost. That is only called as loss of microvilli. Loss of microvilli. Now, we along with the loss of microvilli, remember the most important aspect of what will happen is that so all the cell organelles will become disrupted. Apart from cell organelles will become disrupted, sir, what is the characteristic thing between the reversible and irreversible cell injury? My dear students, here there is no myelin figure. There is no myelin figures. This is a point to be remembered. No myelin figures. This is also called as a cloudy swelling. Okay, because of hypoxia, what will happen is that lactic acid will accumulate. Why lactic acid will accumulate? Because anaerobic glycolysis. So because of that, there will be decrease of the pH. Remember, there is a decrease of the pH. Automatically, it will lead to what? It will lead to something called as pycnosis, my dear student. It will lead to something called as pycnosis. What is pycnosis? Pycnosis का मतलब ये होता है shrinkage of the nuclear material. Shrinkage of the nuclear material. इसका मतलब क्या होता है? Very simple. This means as pH decreases, more acidic pH, more shrinkage of the nucleus. So chromatin will become shrunken in acidic pH and enlarged in a alkaline pH. So this is the most important points to be remembered. So what are the things to be remembered from the reversible cell injury? You would have studied a two-phase theory, among which sodium ATP, potassium ATPase fail, cell swelling, loss of microvilli, no myelin figure, and this is also called as a cloudy swelling. Finished. In irreversible cell injury, remember, there is a severe ATP depletion. Matlab, what will happen? There is a large amount of ATP is not at all formed. So because of which, what will happen? Sodium, potassium, ATPase will fail. Along with that, it will also lead to fail of calcium ATPase. calcium ATPase. So what will happen is very simple. Inside a cell, we have one pump called as sodium potassium ATPase. It used to send the sodium out of the cell and take the potassium into the cell. And we have one more thing here, which used to send the calcium out of the cell called as a calcium ATPase. So severe ATP depletion, sodium ATPase, sodium potassium ATPase close, calcium ATPase will close. So calcium automatically will not go out of the cell. It will increase the calcium in the cell. If it will increase the calcium in the cell, so it will lead to what? It will lead to activation of the enzymes. Activation of the enzymes, such as what is that? Such as the ATPase. Hello. Such as the first and most important point to be remembered, there is the increase of calcium. So calcium is such a factor which will increase the activity of enzyme. Basically very simple, wherever calcium is free, that guy will do something to anybody other. ओके मतलब कैल्शियम चुपने बैठेगा, किसी ना किसी के साथ छेड़खानी जरूर करेगा. याद रखो, सेल के अंदर इनसाइड द सेल इफ देयर इज अ इंक्रीज ऑफ कैल्शियम जरूर करेगा ये छेड़खानी. ये छेड़खानी क्या करता पता है? पहला छेड़खानी मोस्ट इंपॉर्टेंट डिस्ट्रप्शन इट लीड इज द विद द एंजाइम्स. what will it do? It will activate the enzymes. What will it activate? It will activate enzymes such as proteases. It will activate enzymes such as proteases. Okay, then it will activate enzymes such as ATPase. Now think about this. If ATPase is become more and more activated, more ATP is depleted. Okay, now along with that, it will also activate an enzyme called as the endonuclease. So what do I mean by this? Protease activate हो गया, protease is activated, disrupt digestion of protein, cell will break down. ATPase activated, ATP will break down. Endonuclease activated, nuclear material will break down. So this is a mnemonic to be remembered. What is a mnemonic? APE are the enzymes which are activated during the irreversible cell injury. So examiner is least interested in this. Why? Because he will ask you what exactly all the reversible cell injury changes will be present. Matlab cell swelling will be there, pycnosis will be there, all characteristic features will be there. But what is the most important one? Yes, presence of a myelin figure. Presence of a myelin figure. Myelin figures are present where? In the mitochondria. In the mitochondria. If you find them in the mitochondria, where exactly in the mitochondria? Also remember, in the mitochondria especially, you can find them only on a electron microscope. What is that? Electron microscope. So if they give you electron microscope picture of a reversible or irreversible cell injury, then think of what is that? Think of your, what is that? Your, very good, that is your irreversible cell injury. Irreversible cell injury. So this is the important factor. So if there is a irreversible cell injury, it will lead to something called as, my dear students, it will lead to necrosis. So what is that? Necrosis. There are types of necrosis. Very simple to remember. Necrosis ka type 1 necrosis, that is only called as coagulative necrosis. What is that? Coagulative necrosis. सब लोग क्या करते पता है? इसको ना everybody will by head this. Very simple. Coagulative necrosis happens if there is no bacteria. Rule number 1 means what? If I tie your hand here for 3 days very tightly, there is no blood supply. If there is no blood supply, there is no bacteria here. Now, if there is no blood supply, automatically these are all very hard tissue, like muscles is there, like tendons is there, right? Now bone is there. Now what will happen is that this hard tissue will undergo necrosis. So coagulative necrosis can be found in the solid tissues when there is no bacteria. And most important point to be remembered, you find something called as tombstone appearance. What do I mean by tombstone appearance? Very simple. If I take a cell and look inside, if there is a necrosis has occurred. So if there is a necrosis has occurred, so what will happen is that cell membrane will be destroyed, but not as much. Little bit like this. Little bit of cell necrosis as cell membrane is destroyed. But inside the cell, everything has been digested. Now, if you look under the microscope, you know that by looking at the outline. Now, for example, if I give you one cell which is having like this hexagonal shape, I am taking that, telling that what is that? That means it is a cell from the liver. So by looking at the outline is maintained in a coagulative necrosis. Kahani khatam. Let's go to the next necrosis. So since outline is maintained, you are able to recognize which cell it belongs to. That is only called as tombstone appearance. Tombstone matlab kya hota hai? What does it mean? Tombstone means after somebody died, you bury them and you put a stone there. This person born at this person died at this. Like that only. By looking at the tombstone, you can identify the person like that. Only by looking at this appearance you can identify the cell. That is only called as tombstone appearance. Do not miss out. Thank you. Let's go to the next point. What is that? Okay, now what happens is that now bacteria was lurking like this. Are मैं कहाँ जाऊं, है ना? So for that we'll get a liquefactive necrosis. So the next one is called as liquefactive necrosis. Liquefactive necrosis. What do I mean by liquefactive necrosis? Very simple, very simple. There is a high level of proteolytic enzyme. If there is a high level of proteolytic and most importantly hydrolytic enzymes, hydro and proteolytic enzymes will get activated. So what will happen? Everything will become broken down and liquid like lesion. So what will happen is that if there is a necrosis, if it is occurring in the brain, now in this particular area, what will happen? Everything will turn into liquid. Everything will turn into a liquid. Everything will turn into a liquid. Everything will turn into a liquid. Surrounding tissue, what? Surrounding tissue is healthy. Okay, surrounding tissue is healthy, but only in the place of necrosis, liquid-like appearance will occur. This will occur only in the soft tissues. This will occur only in the soft tissues. Okay. Now, all of you know that your favorite thing to remember is most common necrosis in the brain. Most common necrosis, most common type in the brain is liquefactive. Most common type in brain. This is a very favorite question. Most common type in brain. So this most common type in the brain, this occurs as a result of ischemic necrosis. Ischemic necrosis. Hello. Now, listen to me very carefully. Liquefactive necrosis is a necrosis which occurs in the brain. Now, this exactly most common type in the brain. Now, it is not the overall most common necrosis. If I ask you a patient died of a stroke, so stroke patient with a ischemic stroke patient will have a necrosis in the brain. That necrosis in the brain will occur as a result of liquefactive necrosis. This is a very favorite question of examiner. But if I were the examiner, I wouldn't give you this question. I would put you this coagulative necrosis in the trap. So let's solve the trap. We have a necrosis called as classic example Zenker's necrosis. So what is that? Zenker's necrosis. Sir, what is Zenker necrosis? Zenker necrosis is nothing but necrosis of abdominal rectus muscle, in which this is in the patient with a typhoid fever. This is a very favorite question of examiner, but not directly, but from the infection disease side. But this can be asked. So remember these two types of necrosis: coagulative and liquefactive necrosis. The third one which I want to discuss with you people is what? There is something called as a caseous necrosis. What is that? Caseous necrosis. Now, what is this caseous necrosis? Caseous necrosis is like a toothpaste. What do I mean by this? So, first one is solid, second one is liquid. दोनों को मिलाओ toothpaste हो गया. First one is liquid, second one is solid. दोनों को मिलाओ toothpaste हो गया ना. So, basically what happens is that it has a both coagulative and liquefactive necrosis property. It has both coagulative and liquefactive necrosis. So it will give cheese or curd-like consistency. This can be classically seen with syphilis, TB, coccidiomycosis. Finish, sir? Then the next type of necrosis is also a one more thing that is only called as, what is this? This is again most of the very trap, that is your fat necrosis. What is this fat necrosis? Sir, very simple thing to understand. Fat necrosis is such a type of necrosis. It is having two types. One is traumatic. One is enzymatic. Okay, so what do I mean by traumatic? What do I mean by enzymatic? Sir, very simple. Traumatic means, for example, in the anterior abdominal wall. Somebody had a stab injury. Means what is there? See, consider these are your adipocytes. Now, inside the adipocytes, what is there? Fat is there. Now, what will I do? I will do a injury. Means I will have a penetrating trauma, or I will have some other problem. Or for example, injury or some surgery. Because of that, free fatty acids will release. Okay, fatty acids are released. Okay, free fatty acids are released. Now, enzymatic necrosis, consider a patient is having a pancreatitis. Pancreatitis. Now, pancreatitis, there are two problems. So what will happen during the pancreatitis? Pancreatic increase of pancreatic lipase. So if there is an increase of pancreatic lipase, that will also increase the free fatty acids. What do I mean by this? Pancreatic lipase will go and break down the adipose tissue. Two different things. One is trauma. Pancreatic tissue is breaking the, what is that? Fatty acid. So both of these things have a free fatty acid. Because of these free fatty acids, there will be calcium which will combine with free fatty acid, and that will lead to something called as saponification. So sir, what are all the things to remember in the body? Where do you get fat necrosis? Fat necrosis can occur as a result of very good two things. What is that two things? Trauma as well as enzymatic. Enzymatic in pancreatitis. Okay, so enzymatic in pancreatitis and trauma free fatty acid. So both of these, calcium will occur, saponification will occur, a chalky cloudy white appearance will be there. So these deposits will occur in two places. One is anterior abdominal wall, and the second one is your breast tissue of the female, and your buttocks can be possible places, but anterior abdominal wall and the breast tissue is the places where you can get a fat. So the next question, what you are trying to tell, what was that confusion? The confusion is that, see, up the till now, because of pancreatitis in the fat necrosis. Because of pancreatitis in the fat, you are getting fat necrosis. But in the pancreatic tissue, in the pancreas tissue, what will happen? In the pancreas tissue, since it is a soft organ, you will find liquefactive necrosis. Yes, iOS store may it is there. If it is not there, you can just follow the instructions which will be provided on the channel. If not, I'll tell you how to download it at the end of the lecture. Do not worry about it. Okay. So in the pancreatic tissue, you'll get liquefactive necrosis. Please do not get confused. In the pancreatic tissue, liquefactive necrosis. Because of pancreatitis, in the fat tissue, you'll get a fat necrosis. The last one is called as a fibrinoid necrosis. What is that? Fibrinoid necrosis. So fibrinoid necrosis में क्या होता है कि there is a deposition of something called as fibrinoid, a fibrin जैसा material. This is a fibrin like material. It is associated with vascular diseases. मतलब if there is an injury to the blood vessel, only then you are going to get a fibrinoid necrosis. Fibrinoid necrosis can be seen with the first ever disease where fibrinoid necrosis was found is, tell me. First disease. This is a MCQ of AIMS. Remember, that is your first disease, but they'll not ask directly. But fibrinoid necrosis is a Ashoff body. Yes, fibrinoid necrosis can be found in the Ashoff body, but not the first disease. That is polyarteritis nodosa. Remember, fibrinoid necrosis is most specific to pan. Then, of course, Ashoff body. Okay, Ashoff body. But the first answer is always pan. Remember, okay? बहुत लोगों ने, even AIMS aspirants, they had made a mistake this one. So please do not make this mistake. Got it? Let's go to the next one. What is this? That is, my dear students, we have the most important aspect. What exactly is this? So apoptosis. Apoptosis is nothing but programmed cell death. So apoptosis can happen by two pathways. One is extrinsic pathway. Extrinsic pathway means there are some outside factors which start the apoptosis. One more is intrinsic pathway. So intrinsic pathway means inside the cell there is some factors which is stimulated. In this, what are the MCQ? So intrinsic pathway is the most important big pathway. Very simple. Consider this is one cell. Apoptosis ke liye, so if there is cell is getting older and older, so we have some sensors inside the cell. Only we have some sensor. So sensors क्या करेंगे? What will the sensors do? For example, if something goes wrong, sensors will detect. Like that only, the cell sensors will detect. So the cell is getting older. Okay, if cell is getting older, we have to do some repair, right? So that sensors which are within the cell are triggered during the intrinsic pathway. But simple. Okay, if something comes and binds with this, Okay, something called as like this. Okay, if something binds from outside and start killing the cell, then we call it as a extrinsic pathway. Extrinsic pathways is less important compared to that of intrinsic pathway. Let's focus on intrinsic. Now intrinsic pathway sensors, when they get activated, it will act on two type of genes. One is they increase the activity of pro apoptotic gene. Pro-apoptotic gene. Pro-apoptotic means they increase the apoptosis. Pro means supporting. Then they decrease the activity of anti-apoptotic. Both bar badi simple hai. The simple like this. One side is pro-apoptotic, anti-apoptotic. So pro-apoptotic becomes dominant, anti-apoptotic becomes suppressed. So because of this change of balance, apoptosis will occur. So examiner is interested in what? Examiner is interested in apoptotic sensor. So the names of the genes are, yes, BIM, BID, BAD, PUMA and NOXA. इसको कोई तरीका नहीं है, रटना ही पड़ेगा. There is no other technique to escape this. You have to remember apoptotic sensors. BIM, BID, BAD, PUMA, NOXA. BIM, BID, BAD, PUMA, NOXA. Okay. Now pro-apoptotic back and backs. Okay. Then anti-apoptotic genes. Anti-apoptotic genes are BCL 1 and 6. BCL 1 and 6. Then we have MCL. Okay. Then we have one more thing called as BCLXL. Okay. So sir, how to remember? यार इतना याद रखा करो. This, remember this much. All the anti-apoptotic genes will have L in them. All the anti-apoptotic genes will have L in them. Perfect. Done. Then pro-apoptotic genes, remember back and backs. Rest every other thing will be sensors. So sensors will do what? Sensors, when they are activated, that will lead to what? That will lead to increase of pro-apoptotic. And also sensors, when they are activated, they will decrease the activity of anti-apoptotic. Okay, because of this activation, they will activate one enzyme called as caspase. What is the name of the enzyme? Caspase. Now this caspase will create something called as apoptotic body. And this apoptotic body will be removed out of the cell. Okay, so that is the story. Now when there is a apoptosis, remember this caspase is the enzyme. It made out of two important amino acid. One is cysteine, C for cysteine. Okay, ASP for aspartic acid. Okay, so these are the two important amino acid this is made of. Okay, let's go to the next aspect. Sir, if there is a apoptosis, so in the apoptosis, remember, since it is a physiological process, usually physiological, but it can be both physiological and pathological. That much you people all know. Now in the apoptosis, remember, my dear students, there is no inflammation. But in necrosis, of course, there is a inflammation, presence of inflammation. This is a very standard point to differentiate. Now, if there is some tissue, means I'll get a sample. Sir, I have taken a tissue sample from somebody. Look whether there is apoptosis or necrosis. So what I will go and do, I will do a gel electrophoresis. So on the gel electrophoresis, you'll find something like this. Gel electrophoresis. Now, gel electrophoresis is looking at what? Gel electrophoresis is nothing but looking at a genetic material. Basically, we are looking at a genetic material. If you notice here, so as if somebody is doing like this, right? As if somebody is smearing the tissue. Like that, there is one appearance. So this appearance is called as smearing appearance, smearing appearance seen with, my dear students, necrosis. This is a very important MCQ. I have been sharing all the PDFs, and the PDFs were uploaded in the app as well, my dear. Please check in the app. Okay, once the discussion is done, I will be sharing. Okay, and here, very good. What is the answer? Very nice. Here we have a step ladder pattern. What is that? Step ladder pattern. The step ladder pattern is seen with the apoptosis. So you can see one is there, little bigger one, little even bigger one, even bigger. Okay. Now the difference between each of these genetic material is 200 base pairs. 200 base pairs. Okay. Now that much depth may be asked, may not be asked, but step ladder pattern high likely to be asked. Okay. Now the last one is that there is a stain used that is only called as annexin stain, annexin 5 or annexin V. Okay. Now this annexin stain is used. Now annexin stain is used. Annexin stain binds with a chemical which is present in the cell membrane called as phosphatidylserine. Phosphatidylserine. So that is why annexin is used, because annexin binds specifically to a molecule phosphatidylserine. This phosphatidylserine will come out of the cell only and only during apoptosis. Only and only during apoptosis. Okay. Now let's go to the next aspect called as a free radical. Free radical is what? Free radical is nothing but consider any molecule, any substance with what? With free electron in outer shell, in the outermost shell. So sir, will they ask us about the definition? No, they will ask you about the example, the classic examples for the free radical. The classic examples for the free radical, we have OH minus called as hydroxyl. So look here, there is a free radical. Okay, then we have classic example, very very important, H2O2. Okay, H2O2, again it will have a free radical, again very very important. Then apart from H2O2, what else will be there? So you have something called as superoxide. Okay, all of these things are free radicals. Now free radicals, my dear students, again these are like a people who has nothing to do. It can go and react with any part of your body, like it can react with the cell membrane, it can react with the DNA, it can react with the cell organelles. Means very simple, it can cause damage. Okay, so for that purpose only, free radicals, do you have one more favorite free radical, that is your OCl minus, that is your hypochlorite. This hypochlorite only which you used, where do we use hypochlorite? Let's see from PSM, come on. When blood is spilled, it is cleaned with, very good, cleaned with your hypochlorite only. So exactly the same chemical, hypochlorite. So why hypochlorite is used? Remember this point. This is the most efficient. Very good, very good, very good. Most efficient what? Most efficient bactericidal agent. What is that? Most efficient bactericidal agent. That is only your hypochlorite ion, and the same hypochlorite is only used for the blood spills. Very good answer. Now let's talk about the free radical. Any substance which remove the free radicals, are called as scavengers. Any substance, जो भी substance free radical को remove करेगा उसी को बोलते हो scavenger. So in your simplified way, so all of you know this, right? Girls, you apply glutathione to the face, right? Why do you apply? Let's see. Okay, even better answer than that. You apply your, what is that? You apply your vitamin C to the face. Why? हाँ बताओ, जल्दी बताओ, अभी काफी टाइम है मेरे पास. Okay, we can quickly do this. You can just try, give me an answer. Let's see. Why do you apply vitamin C? Whitening ना. Whitening से ज़्यादा most important point है, not for whitening. Very good, because this is the antioxidant. Anti नहीं है भाई, ये antioxidant. It is a antioxidant. So any substance which remove the free radical is called as antioxidant. Okay, because these can cause damage to the cell. They will cause damage to the cells. Along with that, they will also cause aging. Okay, so this is the reason why you used this. What is that? Scavenger, and that is your antioxidant. Antioxidant, the first one is vitamins. So which vitamins? Vitamin A, vitamin C, vitamin E. Yes, E. Okay, vitamin C, vitamin A, C, E. Okay, now red wine will decrease the aging but not as greatly. Okay, then the second one, in your body you have, what is that? Enzymes, my dear students. This enzymes के ऊपर एक बहुत बढ़िया क्वेश्चन आता है. So listen to me very carefully. Okay, so what exactly happens is that we have superoxide. We have a superoxide. Okay, now superoxide. See, those are all aging preventing factors. एजिंग करवाने का एक फैक्टर है तुम्हारा दिस वन, ओके, बट नॉट एवरी सिट्रीन इज एंटी एजिंग. सिट्रीन्स एक्चुअली नॉट जस्ट वर्क विद द फ्री रेडिकल बट आल्सो एक्ट अपॉन द टीलोमेरेस लेंथ, है ना. तो आगे बढ़ते हैं हम लोग उस चीज को बताऊंगा मैं. सुपर ऑक्साइड दैट इज योर O2 माइनस था ना, तो सुपर ऑक्साइड दैट इज योर O2 माइनस that will be broken down by an enzyme called as SOD, that is your superoxide dismutase. Okay, superoxide dismutase, my dear students, listen to me very carefully, it will break the superoxide into H2O2. ठीक है, जब H2O2, वेरी गुड आंसर, जब H2O2 is there, this H2O2 can be broken by an enzyme called as catalase. catalase ये कहां पे होता है? catalase in the tissues. remember, in the tissues, please remember, catalase is present in the tissues. It will break it into H2O plus water. Okay, then also we have in the RBC, majorly in the RBC, but other places also there. In the RBC, we have an enzyme called as glutathione peroxidase. What is that? Glutathione peroxidase. Okay, so that will also remove the H2O2. Now the point is that, listen to me. यहाँ पे दो चीज बन रहा है, देखो यार, एक पानी हो गया H2O plus O2, H2O plus O2. 1 second, plus O2. Okay, what are the two things which are mixing here? Come on, tell me. Yes, solid, liquid and a gas. If liquid and a gas mixes, what will happen? यार पानी के अंदर से तुम लोग गैस मतलब if you pass some air into the water, what will happen? Froth will come, right? So the same thing during wound cleaning. So listen to me this very very carefully. आप लोगों को ज्यादा कुछ समझने का लिखने का जरूरत नहीं. You don't have to write much. Just listen to me this point very carefully. They will give you this hypothetical scenario. A patient met with a road traffic accident, came to the hospital with a bleeding wound. On the bleeding wound, H2O2, hydrogen peroxide, was added for wound cleaning. Upon adding hydrogen peroxide, there was no froth. Formation. That indicates deficiency of which enzyme? Cleaning के लिए you put H2O2. As soon as you put H2O2 is exposed to the tissues. H2O2 exposed to the tissues, तो tissues के अंदर कौन है? Catalase है. Catalase क्या करेगा? H2O2 is broken into what is that? H2O plus oxygen. So that breaking down is not occurring. So which is deficient? Catalase is deficient. The best answer is catalase. Because we are not talking about RBC, my dear. In the RBC, glutathione will undergo peroxide reaction. ओके, सुपर ऑक्साइड डिस्म्यूटेस नहीं है. आप लोग सुपर ऑक्साइड के ऊपर क्यों जा रहे हो? आप लोग सीधा इन द वुंड यू आर एडिंग H2O2, आप सुपर ऑक्साइड क्यों लेके आ रहे हो? सोच के देखिए. Am I telling right or wrong? सोचो एक बार. हम लोग वुंड के अंदर डाल रहे किसको? इन द वुंड डायरेक्टली वी आर एडिंग H2O2. If we are adding directly H2O2, where exactly it is going? Into the tissue. In the tissues, what is not there? Catalase is not there. Yes, H2O2 and O2 is not there. तो froth नहीं बनेगा. ये बहुत फेवरेट क्वेश्चन है. तो ये क्वेश्चन देख के चौंक मत जाना. कौन सी एंजाइम ऐसा मैं सुना ही नहीं है. ठीक है, ऐसा कुछ नहीं है. डॉक्टर मारुति ने एग्जाम के कई दिन पहले बताया था, याद रखो. ठीक है, लेट्स कंटिन्यू टू द नेक्स्ट एस्पेक्ट. व्हाट इज दैट? दीस आर द टू इंपॉर्टेंट स्कैवेंजर्स. देयर आर अदर स्कैवेंजर्स आर देयर. आई एम नॉट इंटरेस्टेड इन देम because we are barely 5 days away from the exam. Okay, now let's go to the calcification. Calcification का मतलब होता है कैल्शियम deposition. ठीक है, अब कैल्शियम, whenever there is a calcium deposition, there are two types of calcium deposition. That is called as dystrophic. Okay, there is one more thing called as metastatic. Sir, what do you mean by metastatic? What do you mean by dystrophic? When you are learning, your learning curve itself was taken into a table alone. Okay, very simple. For example, there is a dead tissue, my dear. There is a dead tissue. यहाँ पे क्या हो गया? There is a dead tissue. Inside this dead tissue, if calcium deposits, then we call it as a dystrophy. For example, I have increase of calcium in the blood. So if there is an increase of calcium, so much calcium, अभी इतना ज़्यादा calcium, there is too much of calcium. Okay, చాలా ఎక్కువైపోయింది. Okay, too much of calcium. If too much of calcium is there, now calcium will get confused. भैया मैं क्या करूँ? What will I do? So this calcium will go on deposit. वो बोलेगा रुक जा, अरे भाई बहुत अच्छा दिख रहा है, रुक जा मैं आता हूँ. Wow, what a scene. I will get and settled here. So that type of scenario we call it as a metastatic calcification. Metastatic calcification is nothing but increase of serum calcium and calcium deposit in a living tissue. Deposit in a living tissue. Calcium deposit in a living tissue. Here in a normal serum calcium, but this deposition occurs after cell injury. Cell injury के बाद क्या होगा? Inflammation. Inflammation के बाद healing. Healing के बाद calcium deposition. That type of calcium deposition in the dead tissues. In the dead tissues. Okay. Now don't have to remember 1,000 examples for this. Okay, so anywhere in the dead tissue, but metastatic calcification, I want you to remember there is a condition such as a hypervitaminosis D, hypervitaminosis D, hypervitaminosis D. Wow. Okay, then you have a condition called as scleroderma, metastatic calcification. Then we have a disease called as a milk alkali syndrome, milk alkali syndrome. So these type of diseases will cause a metastatic. If there is a necrosis, if there is some rheumatoid arthritis, if the cell is becoming dead or inflammation is occurring, if there is a inflammation, the cell injury is occurring, followed by the cell injury, if calcium deposit, always dystrophic calcification. Simple. Dystrophic damage dead tissue. Finish. D dystrophic damage dead tissue. याद हो जाएगा? यस सर नो? ये तो बताओ, मजा आ रहा है? मजा आए ना आए, समझ में आ रहा है कि कॉन्फिडेंट नहीं हो रहे हो? इतना कॉन्फिडेंट हो रहे हो कि नहीं? बस ये चाहिए मुझे. यस, वेरी गुड. चलिए आगे बढ़ते हैं. नेक्स्ट वन. वेरी गुड, थैंक यू. चलिए आगे बढ़ते हैं. नेक्स्ट वन, लाइपोफस्चिन. व्हाट इज दिस लाइपोफस्चिन? ये ऐसा वाला स्लाइड देखते हैं तुम लोग, ओ भाई गॉड क्या हो क्या रहा है यहाँ पे. ठीक है, पहली चीज डरना नहीं चाहिए. क्यों? क्योंकि यार लॉजिक 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 आधे टाइम पैथोलॉजी वाले, पैथोलॉजी कभी pathology, whenever you send a slide, pathology will never accept a slide or sample without a clinical history, because they also know that clinical history needs to be correlated. So lipofuscin, what is this lipofuscin? Lipofuscin is very simple. यार तुम लोग मतलब you just do one thing, you take a bike and you are driving it very fast on a highway. Okay, suddenly some dog came in between, so you hit the brakes. Right? When you hit the brakes, your bike is going to make this screeching sound. Okay. Now, if you go back and look, wherever you had a skid mark, right, that full area will turn black. Why? Because your tire has been scratched there and tire particles has been accumulated on the road. Simple sense, hai na? Okay. Simple sense, right? Like that only. Whenever there is a excessive work, remember, if there is a excessive work, that means wear and tear. So if there is a excessive work, okay, if the person is getting old, means there is a increased activity, matlab pura lifetime the organ has worked, right. So for example, senile. Okay, and remember this lipofuscin can come as a result of free radical also, boss. It can come as a result of free radical also. Okay, because of all of these things, what will happen in the two major parenchymatous organ? एक होता है दिल. Okay, so जब दिल को चोट लगेगा, भुक्त कौन करेगा? लिवर. You get my point? Means if you get hurt, right, with your heart, then you're going to drink and damage your liver. The same concept you can apply. Only two organs which will have lipofuscin are these two. Okay, what are these two organs? Lipofuscin can be found in the dil, that is your heart, and as well as your liver. These are the two organs, parenchymatous organs, where you can find lipofuscin deposition. So this can occur as a result of wear and tear, senile, age, and also free radical. So this is a type of which color pigment? A brown color pigment, sir. They gave me a cell. Now how will I find out whether it is brown pigment? Where I should look for? Remember one keyword here. The keyword is this one. What is that? Perinuclear. Peri means around. Perinuclear means around the nucleus. So let's look here into the image. Okay, now देखो भैया यहाँ पे देखो ध्यान से. Okay, you see this nucleus? Yes. Around the nucleus, can you see this brown pigment? Yes. Can you see this nucleus here? Yes. Can you see the brown pigment around the nucleus here? Yes. Can you see the nucleus? Yes. Around the nucleus, brown pigment. So what exactly I am trying to tell you? What is this? That is your very simple perinuclear deposition. बिल्कुल ओके, पेरी न्यूक्लियर डेपोजिशन बस। ओके चलिए आगे बढ़ते हैं, लेट्स गो टू द नेक्स्ट कॉन्सेप्ट, इन्फ्लेमेशन। यार इन्फ्लेमेशन के अंदर ना तुम लोग जितने भी पढ़ो आता रहेगा बट क्वेश्चन के लिए जो काम की चीज है वो देखते हैं, है ना? बस वेरी सिंपल, इन्फ्लेमेशन इज नथिंग बट व्हाट, इन्फ्लेमेशन इज नथिंग बट it is a response to the external stimulus which is a damaging stimulus. For example, you prick your hand or you burn your hand or there is some allergy in your hand. All this time your body is trying to protect what? Here मान के चलो you have an allergy. Now allergen has come into the skin, but from the skin it is not supposed to go all over the body. Your body is trying to protect, to limit in that particular area. That is only your inflammatory response. So during this inflammatory response there is a lot of things going on. Okay, so all these events can be divided, means there are some changes which occurs in the blood vessel called as vascular event, there are other changes which occurs with the cell called as cellular event. Pehle, during the inflammation can be divided into two types, acute and chronic. Acute is a sudden onset and can be resolved itself. Acute inflammation predominantly mediated by neutrophils. Chronic inflammation long term, okay, where there is a healing and damage which is occurring together, and also that is predominantly mediated by lymphocyte and macrophages. Okay, now what exactly is the most important thing is that vascular event. So wherever there is an inflammation, chahe allergy ho gaya, bacteria aa gaya, wound ho gaya, let's take a wound is the best example for us. So there was a wound, bacteria has come in, there is an inflammation going on. So what happens in the cells? The first and most important thing, what exactly is that? The first event is that a transient vasoconstriction. ट्रांजिएंट वेसो कंस्ट्रिक्शन, वेसो का ट्रांजिएंट मतलब फॉर ए वेरी ब्रीफ पीरियड ऑफ टाइम, जैसे इन्फ्लेमेशन शुरू होता है, as soon as inflammation starts there is what, vasoconstriction. First there is a small time, very few seconds, followed by that vasodilation. Now once we teach you vasodilation and send you people into the exam hall, examiner will get very brilliant. Why does vasodilation occur? All of you, despite knowing the answer, you will mark the wrong thing. So do not mark a wrong answer. The answer is yes, again your histamine only. Yes, during inflammation, any vasodilation, predominant answer is histamine. Histamine is a vasodilator. Very good, my dear student. Very good, very good. Okay. Now, चलिए आगे बढ़ते हैं. What is the third one? If there is a vasodilation, है बहुत simple है. ऐसा blood vessel था ना? Blood vessel के अंदर, if there is a endothelium is becoming like this. Okay. Now, if there is a endothelium is becoming like this, and also there is a vasodilation, means contraction of the endothelium and vasodilation. Because of vasodilation, what will happen? All the fluids will leak out. Fluid will come out. Yes, milega, PDF milega at the end. At the end of the class, you can go to our app. You can get it from there. It will be uploaded. Okay, so vasodilation followed by that, very good, that is your exudation. Exudation means what? यार exudation पढ़ के ना confuse मत होना. जैसे ही blood vessel dilate होगा भाई leak होने लगेंगे. ठीक है, लीकेज ऑफ द फ्लूइड फ्रॉम वेयर, फ्रॉम द ब्लड इज कॉल्ड एज एक्सुडेशन. तो एक्सुडेशन कब कैसा होगा? सोच के तो देखो, व्हेन यू बर्न योर हैंड देयर इज नो बैक्टीरिया, नथिंग, ए क्लियर फ्लूइड विल कम आउट. Right? When there is a bacteria, there will be pus, neutrophil, etc. will come. Point simple. So exudation depends on the cause. If there is a viral infection in the superficial nasal mucosa, what will happen? Only catarrhal inflammation, only superficial nasal mucosa inflammation, and all the mucus will be coming out so that virus can be removed. If there is a burn, what will happen? Blister will form, clear fluid exudation. So based on the cause, there will be changes. So based on the cause, based on the type of exudation, most common type is catarrhal inflammation. मोस्ट कॉमन टाइप इज कैटरल इन्फ्लेमेशन. कैटरल इन्फ्लेमेशन क्या होता है? सुपरफिशियल म्यूकोसल इन्फ्लेमेशन. क्लासिक एग्जांपल जो आपका कॉमन कोल्ड होता है, रिनाइटिस होती है ना, रिनाइटिस में इतना इतना म्यूकस बाहर निकलता है ना, वो कहां से आ रहा है? ओनली फ्रॉम द सुपरफिशियल म्यूकोसा इटसेल्फ. दिस इज द मोस्ट कॉमन टाइप ऑफ exudation का हिसाब से, based on the exudate, if we are classifying, that is most common exudate is this one only. Okay, so in this exudation there can be exudative and transudative types that you will study in the pathoanatomy, but it is not important for our MCA exams. Okay, cellular event मतलब there are some changes which occurs with the cell. What happens is that, मान के चलो here is the blood vessel, अब here is the site of inflammation. तो blood vessel के अंदर कौन है भाई? WBC. blood vessel के अंदर who is there? WBC. Now this WBC in the center of the circulation with the blood flow, ये भागे जा रहे हैं, running. Okay, now what is there? Here is the bacteria which has come, right? Now the WBC has to get out of the blood vessel and come to bacteria. That is our target. So let's do how exactly. First and most important, ये दौड़ रहे हैं, okay? बोले अरे भैया रुक जा यहाँ पे inflammation है. Bro, stop, there is an inflammation here. Now what exactly will happen? This bro, okay, if there is inflammation, okay, he'll come to the margin first. So the first stage is called as margination. Margination is usually due to vasodilation itself. Usually due to vasodilation. Margination के बाद see the neutrophil is running with the blood flow. इतना तेजी से भाग रहे हैं, तेजी से बुलेट ट्रेन जैसा, ठीक है? अब ऐसे ही छोड़ दोगे क्या? No, now this WBC which was running, it has to be stopped. So that stop will be done by rolling. Rolling means what will happen? Stopping of the neutrophil. So these neutrophil stopping will take the help of can anybody tell me will take the help of what? Come on, it'll take the help of sialyl Lewis protein. Sialyl Lewis protein कहाँ से आता है? ये blood vessel का endothelium से. Means if you hit a brake, right, there are two things which require. One is from the endothelium side. That is your sialyl Lewis protein. No, that is from the endothelium side. Usually we are going to get, my dear students, that is your selectins. Very good, selectins. You have E-selectin and you have P-selectin, and this E-selectin and P-selectin come from the endothelium, and this one will come from the WBC, that is only your sialyl Lewis glycoprotein. ये दोनों के साथ बॉन्ड जुड़ेगा तब भी जाके रुकावट आएगी. That is the time when that neutrophil will stop, called as rolling. Followed by that, it will take the help of a that is called as CAM, cell adhesion molecule. Now what will happen is that this neutrophil will tightly attach with the WBC. After that it has to come out of the blood vessel. So blood vessel से बाहर आने को क्या बोलते हो? That is only called as transmigration. Transmigration can also be called as diapedesis. Means, so what had happened so far? You had a blood vessel, the WBC had come here. Here is the site of inflammation. Now this WBC will come out of the from the blood vessel. These diapedesis require, the most important one is a PCAM, that is your CD31 बोलते हो इसको, ठीक है? CD marker 31. आप दूसरी गलत करते हो. I just want to take this second and tell you people, do not make this mistake. What is this mistake I have seen? What is the mistake is that grand mistake many people does is they want to do what, they want to remember all the CD marker. ये नहीं होने वाला, ठीक है? I will tell you which are the CD markers to be remembered. Follow that only. Hello मुकेश, कैसे हो? चलिए आगे बढ़ते हैं. So what is that? That is your CD31, right? Now let's go to the next important aspect, diapedesis and transmigration. ये बाहर आ गया WBC. Once it comes out of the blood vessel, now this fellow is confused. भैया मैं कहाँ जाऊँ? Where shall I go? Now bacteria is somewhere. Here is the bacteria. Now there should be one directional movement of WBC. Remember that one directional movement of WBC towards the bacteria or the site of inflammation is called as chemotaxis. Chemotaxis means unidirectional. मैं बैंगलोर में हूँ यार भाई. Unidirectional. Okay. Now unidirectional and towards your, what is that? Towards the, very good, very nice to see you. We are very happy to see you. बहुत टाइम क्या है ना? So towards the inflammation site. So this is a very, very important point. What is that important point? This important point is that unidirectional movement. ये बहुत important word है, because this unidirectional movement can be the trap for you people. ये बहुत बार trap किया हुआ है. So please be ready with it. Okay. So if this unidirectional movement has to occur, so that requires chemokines. My dear students, what is that? Chemokines are the factors which help in the chemotaxis. तो भाई ये बहुत अच्छे से रट लो, ये बहुत important है. C5A. What is that? Repeat with me. C5A. Repeat with me. C5A is a chemokine. leukotriene B4, LTB4, interleukin 8. Repeat karo, interleukin 8 and bacterial products. Let's repeat them once again. C5a, interleukin 8, LTB4 and bacterial products are your, what is that? Very good. Are your chemokines. Chemokines. Once chemokines means what happened? There was a bacteria which was sitting here, right? Bacteria was sitting here. Yes, WBC has come all the way to bacteria. Once WBC comes, now WBC will recognize the bacteria. Okay, you belong to my body or somebody else. That process is called as recognition. For that recognition, it uses two types of receptor called as Manos and scavenger receptor. Okay. ठीक ठाक इंपॉर्टेंट बट मोस्ट इंपॉर्टेंट इज ऑप्सोनाइजेशन. ऑप्सोनाइजेशन बहुत सिंपल है. देखो यार, ऑप्सोनाइजेशन इज नथिंग बट जब समोसा खाने के लिए बोलूंगा, इफ आई टेल यू टू ईट समोसा, व्हाट डू यू नीड विद समोसा? ये तो बताओ, व्हाट डू यू नीड विद समोसा? कीमोकाइन इज C5 है. समोसा के साथ क्या चाहिए था? चटनी चाहिए था. सो you have your samosa. Samosa is tasty, but with chutney it becomes more tasty. Exactly, bacteria, whatever bacteria is there, that will become more tastier for the WBC during the process of opsonization. Means to increase the efficiency of phagocytosis. To increase the efficiency of phagocytosis, whatever bacteria was there like this time, on the bacteria, I will coat it with something. I will coat it with, for example, something. Now, by looking at this something, WBC will get more attracted to this, called as what is that? That is your, what is that? That is your, very nice, that is your opsonization. Opsonization is nothing but coating of bacteria with a opsonizer. ये वाली बंदे हैं भाई, opsonizer. अरे वाह, क्या टाइमिंग में यार. opsonizer, ऑटो करेक्शन में opsonizers हो गया, opsonizer. Okay, opsonizer list. C5a is a chemokine. Remember, C5a is a chemokine, but C3b, C4b, C5b, all the B's are opsonization or opsonizer. So remember how to remember. First process is chemokinesis, that is why C5a. All the B's, C3b, C4b, and C5b, all of them are opsonizer. Immunoglobulins such as immunoglobulin G and C-reactive protein and fibrinogen are your opsonizers. So remember, among which all of the following are opsonizer except question aega, and this will be the 3 option and C5a will be the 4th option. Okay, FC part of your immunoglobulin. Okay, so what I'm trying to tell you is that opsonizers are the coaters on the bacteria. Then once the bacteria is coated and WBC is bound here, now WBC will engulf the bacteria, called as engulfment. ओके अरे ये इससे भी अगर किसी को कंफ्यूज होता है ना, इफ एनीबॉडी साउथ इंडियन लाइक फ्रेंड्स वाचिंग विद मी, तो फॉर यू पीपल, इफ यू कांट रिलेट विद समोसा, डोंट वरी, आई विल गिव यू बेटर एग्जांपल. ओके, एट मॉर्निंग वी गो टू ब्रेकफास्ट, वी ऑर्डर, आवर फेवरेट ब्रेकफास्ट इज इडली, वी ऑर्डर इडली. ओके, इफ एनीबॉडी गिव्स इडली विदाउट चटनी, वी विल किक देम, right? Because idli is good, yes, it is tasty, whatever, but we need chutney. So like that only. Okay, so opsonization, yes, that is also a good way. Okay, let's continue. The last one is, yaar itna kahani क्यों किए थे? We did all this drama for what? For killing of the bacteria. For what? इसलिए किए थे? बैक्टीरिया को किल करने के लिए. For what purpose we did? For killing of the bacteria. So killing of the bacteria will occur. So ये killing के अंदर भी कहानी बड़े बड़े interesting है. What is that? Killing will occur 2 types. What are the 2 types of killing? O2 independent. O2 independent. ओके, और एक होता है O2 डिपेंडेंट. O2 डिपेंडेंट. एग्जैक्टली राइट, एग्जैक्टली. हाँ, समोसा सिर्फ हरा चटनी, सिर्फ मीठा चटनी, सिर्फ एक देने से वो भी क्राइम होता है. दोनों देना भाई. हाँ, नहीं तो फिर मजा नहीं आएगा. ओके, O2 डिपेंडेंट एंड O2 इंडिपेंडेंट. O2 डिपेंडेंट मतलब किलिंग के लिए O2 चाहिए था, दैट इज वन मैकेनिज्म. इफ O2 इज नॉट नीडेड, वो इंडिपेंडेंट बोल दिया हमने. ठीक है, बढ़िया. नाउ O2 इंडिपेंडेंट कैसा होता है? नाउ लेट्स गो बैक टू योर बेसिक. व्हाट इज दैट? ऑल द WBCs आर क्लासिफाइड इनटू 2 टाइप्स, ग्रैन्युलोसाइट, एक ग्रैन्युलोसाइट. हाँ, पूरा स्कूल में पढ़े थे. एक में ग्रैन्यूल रहते, एक में ग्रैन्यूल नहीं रहते. इन वन ग्रैन्यूल्स आर देयर, इन वन ऑफ देम ग्रैन्यूल्स आर नॉट देयर. दैट इज द क्लासिफिकेशन ऑफ WBC, granulocyte and agranulosite. But we never asked one question, sir, what is present inside that granule? And inside that granule, what is there is enzymes. Inside that granule, what is there is a enzymes. Exactly. That granular enzymes will play. Granular enzymes. Okay, called as azurophilic enzymes, okay. Now O2 dependent means, now O2 dependent is bigger. What is this O2 dependent? Let's take this is a WBC. In the WBC, it has engulfed the bacteria is the antigen. This fellow is sitting somewhere in this card. Okay, on the other side, on here there is an enzyme. The name of the enzyme is called as NADPH oxidase. NADPH oxidase. NADPH oxidase is coated by an enzyme called, coated by a gene called as POX gene. Coated by a gene called as POX gene. Okay. Now this NADPH oxidase will take the oxygen, will take it inside, so it will become O2 minus, means it will become super oxide. Wow, nice. Super oxide. Okay. Now this super oxide, my dear student, will enter into a pathway called as MPO halide system. MPO halide system. Because of this MPO halide system, all of you would have studied this Fenton's reaction, etc., etc. But MPO halide system is my interesting one, because this fellow will produce me what is that OCl minus, that is hypochlorite. Now you people should tell me, what is hypochlorite famous for? Killing of bacteria, right? Because it will go and kill the antigen. So for everything we required, what is that? O2 burst. O2 burst. This is only called as O2 burst, right? Respiratory burst. अगर POX gene के अंदर defect आता है, if there is a defect in the POX gene, NADPH oxidase is not there, O2 burst will not be there. If O2 burst is not there, then superoxide नहीं आएगा. That will lead to what is that? That will lead to immunocompromised scenario. This is a very important point. Will you remember this? Okay, so O2 dependent require NADPH oxidase. Perfect. Let's continue to the next point, next aspect. Chronic inflammation. बढ़िया. Chronic inflammation अरे बड़े simple होते हैं यार. Chronic inflammation is nothing but what? यहाँ पे दो चीज होता है. What are the two things? Here inflammation and effort of healing. Effort of healing. Effort of healing. Both of them occur together. Both of them occur together. Both of them occur together. We call it as a chronic inflammation. What do I mean by this? So if there is a chronic antigen, right? Chronic antigen. Now chronic antigen, my dear students, it will activate two types of macrophages. It will activate something called as classic macrophages, classical macrophages, जिसी को बोलते हो आप लोग M1 मैक्रोफेज, है ना. तो क्रोनिक एंटीजन दूसरे को भी एक्टिवेट करता है. अल्टरनेट पाथवे, alternate macrophages are what? M2 macrophages. Alternate macrophages are what? M2. So if M1 macrophages are activated, they will cause standard जो normal inflammation करवाता है, inflammation and destruction. If alternate macrophages are activated, then what will happen? They will lead to one interesting thing. Yes, alternate macrophages are activated. Alternate macrophages, if they are activated, they will cause a healing and fibrosis. Okay, though means M2 macrophages are anti-inflammatory in nature. Anti-inflammatory. So this is the story of your chronic inflammation. So because of chronic inflammation, they will lead to most of the time granulomas. So examiner is interested in granulomas. Granuloma is nothing but very simple. So जो भी antigen bacteria जो भी था वो center में रहेगा. That will be surrounded by multiple types of WBCs, so that whatever that bacteria is there, it will not spread from that one particular location. That is the case of your granuloma. So granulomas can be divided into two types. What is that? Cageating granuloma, non-cageating granuloma. Sir, what is cageating? What is non-cageating granuloma? अरे बड़ा सिंपल फंडा है. तो cageating granuloma आपको रटवा दिए जिंदगी भर. सार्काइडोसिस, क्रोन्स डिजीज, रूमेटाइड आर्थराइटिस, शुगर्स. यार इतना रटने का जरूरत ही नहीं थी. There is no need for you to buy it. So I will tell you how. Very simple. For example, there is a granuloma. Okay. Inside the granuloma, antigen is there. Inside the antigen, inside the granuloma antigens. जब एंटीजन होता है तो सोचो दिस एंटीजन कैन बी एनीथिंग राइट. इट कैन बी फॉर एग्जांपल अमिलॉइड, it can be autoantibody, it can be sarcoid, it can be bacteria. So exactly, if antigen is non-infectious, matlab it is not caused by any bacteria or not caused by any type of fungus or a parasite. If it is not caused by infectious origin, non-causation. अगर infectious origin है causing granuloma, बस बात खत्म. अब सोचो sarcoidosis है. Sarcoidosis is a disease where there is a deposition of sarcoid but there is no inflammation. Sorry, if there is no bacteria. All of us know that. Crohn's disease as an autoimmune component, rheumatoid arthritis as an autoimmune component, Churg-Strauss disease as an immune complex component. इन चारों में कहीं पे भी infectious component है क्या? There is no infectious component in any of these. So that is why they cause which granuloma? Non-caseating granuloma. So non-caseating granuloma, infectious or non-infectious? Non-infectious origin बात खत्म. Okay, if there is the infectious origin then we will have story different. Infectious origin आएगा तो क्या बैक्टीरिया आएगा. अब सिफिलिस बोल दूंगा, सर सिफिलिस नो डिस्कशन, कीजिएटिंग ग्रैनुलोमा. टीबी कीजिएटिंग ग्रैनुलोमा, कॉक्सीडियोमाइकोसिस कीजिएटिंग ग्रैनुलोमा, ओके मलेरिया कीजिएटिंग ग्रैनुलोमा, कहानी खत्म. सो नॉन कीजिएटिंग एंड वी हैव, लेट्स गो टू द नेक्स्ट वन, वी हैव कीजिएटिंग ग्रैनुलोमास. Caseating granulomas, you will find infection present. Okay, so now see, very good, cat scratch infection hai, LGV infection. So necrotic granulomas can be found usually with your syphilis. So in the center there will be necrotic changes, and caseous necrosis will be found with TB. Finished. And also necrotic granulomas can be found with coccidiomycosis, and also you can put LG. Clear? So these are a type of necrotizing granuloma, but necrotizing which granuloma? Caseating granuloma, sir. Okay. Then stellate granuloma. Throughout your life, remember this word stellate. Stellate matlab star, means star. Okay. Now, exact star shape is not there, but if you look very quickly, star shaped granuloma you can find. This is a granuloma approximately in the shape of a star. Okay. तुम pathology में ये expect मत करना पूरा ऐसा star मिलेगा ऐसा, है ना, ऐसा ऐसा एंड्स के साथ कुछ नहीं होने वाला है. सो दिस इज अप्रोक्सीमेटली लुकिंग लाइक ए गैलेक्सी और stellate granuloma. So this stellate granuloma can be found with very good, already answer has been put in the message, that is your very good cat scratch disease. Cat scratch disease. Okay, so this is an important point to be remembered. So this is only stellate granuloma. Okay, let's go to the next one, that is your Dirk's granuloma. Dirk's granuloma. दरअसल सुन लो, Dirk's granuloma. Dirk's granuloma can be found in malaria patients. Can be seen with malaria. Okay, so that finishes your Dirk's whatever granuloma you want to call it. Okay, let's go to the next one. Healing के अंदर you are going to study primary intention, secondary intention, fibroblast. Okay, yes, very good point to be noted. In the cerebral malaria you are going to find. Okay, now you will study all of that, but examiner is interested in these images. What are these images? These images are nothing but after healing. यार बहुत सिंपल से एक आइडिया बताता हूँ. Anywhere if healing occurs, there can be formation of fibrous tissue called as connective tissue or also called as scar tissue. कहीं पे भी healing होता है. आप आखिर like you go for healing in the heart. MI आया था patient को, sir patient had a MI, post MI healing will occur on the heart, there will be scar. Okay, very good, both are correct answers. So what I'm trying to tell you, whenever there is a healing will always followed by scarring. So that healing can like for example you studied live stricture in surgery, हो जाता है ना, some people drank a caustic material and stricture occurred. Why? Fibrosis and healing. Okay, fibrosis and healing. Okay, so let's continue to the next aspect. What is that? So these fibrosis and healing, for example, there is a wound, my dear students. If there is a wound, now what will happen? Oh, sorry, causative organism of cat scratch disease, Bartonella. He already gave you the answer. Very good, my dear. Okay, so we have something called as hypertrophic scar. Hypertrophic scar. hypertrophic scar, and we have these two images called as keloid. So what exactly happens here is that, imagine I had a patient who came for the surgery. Now during the surgery, I had this wound here. Okay, I cut this area. Now after healing, what happens in this line only, but excessive connective tissue will be there. Excessive connective tissue, but within the wound line, within the wound line. See, for some infectious diseases, there are multiple microorganisms. Okay, within the wound margin, within the wound margin. Okay, within the wound margin. Okay, within the wound margin. Okay, within the wound margin, to be remembered very importantly. Okay, why don't they give this types question? Why they will not give you this type of question? उनको भी पता है कि दो ऑप्शन लगाएंगे तो ऑटोमेटिकली कोई भी मार्क करोगे तो तुम्हें ग्रेस मार्क देना पड़ेगा, इसलिए। ठीक है, वो भी चालू है भाई, हमसे बहुत चालू है वो लोग, वो कभी नहीं फंसेंगे, हमें फंसाएंगे। ठीक है, now in the wound margin. Okay, in the wound margin. Now it is usually self-limiting, no treatment is required. No treatment is required. Now here keloid. Keloid, wherever there is a wound, मान के चलो the wound was there, so wound was there here, but wound margin से बाहर ऐसा connective tissue आएगा. So beyond the wound margin, beyond the wound margin, point number one, and it can also be congenital. It can also be congenital, congenitally exposed. Okay, so most common in two places. What are the two places I'm showing here? Two places. The place number one is your, very good. The place number one is your shoulder, my dear students. What is that? Shoulder. So shoulder, yes. Then the place number two is ear pinna. The place number three is sternum. Place number three is your sternum. These are the places where there can be three possible places where there is a high likely keloid can occur. But keloid question is not going to be like, oh, I will give you a ear picture and ask you, sir, what is the diagnosis? No, he is way beyond, way past that. Okay, he will ask you directly treatment of choice for keloid. ट्रीटमेंट ऑफ चॉइस फॉर कीलॉइड, अगेन यहाँ पे बहुत ध्यान 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 से देखना है यहाँ पे. Why? Because triamcinolone everybody has by heart. Okay, if I am making the question, I will give exactly everybody knows the answer is triamcinolone. I will give three options filled with triamcinolone: oral, cream, intralational, IV. All the four options: IV, oral, intralational, cream. So the answer is, see, listen to me, ये point देखो, ये word intralesional, okay, intralesional triamcinolone, okay. Intralesional मतलब क्या होता है? Load the triamcinolone, directly inject it into the keloid, है ना, directly inject it into the keloid. That is the most important. इंट्रालीजनल, क्योंकि बहुत सारे लोग, इसको क्वेश्चन मैंने एक टीएनडी करवा रहा था, एक क्वेश्चन दे दिया, चारों ऑप्शन में ट्रायम्सोलोन, चारों ऑप्शन में बोल्ड, वेरी बोल्ड ट्रायम्सोलोन लगवा दिया मैंने. ठीक है, अब आधे बच्चे तो आईवी लगा दिए, आधे ओरल लगा दिए, कई और लगाए cream. Only few who paid attention. So that attention I want you few days before the exam, because this is a place where we can avoid all the mistakes. Got it? Very nice. Chaliye, let's go to the next aspect, that is your immune system. What is that? Immune system. When we are talking about immune system can be of two types: innate immunity and adaptive immunity. Very good, very good. All of you are correct. Okay. Now, innate immunity. What is innate immunity? What is adaptive immunity? यार बहुत बात simple सोचनी चाहिए. Innate, अंदरूनी, inside you, right? So you get it from your mother, right? Immediately after the birth. Your immune system is not developed, but still mother is protecting you. अब कोई यहाँ पे तंदा ने नाने 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 ने नहीं बजाएगा. ठीक है. Now innate immunity means what? Innate immunity is nothing but what you get from the mother, or which is basically there from the birth itself. It is there from the birth itself. ठीक है. Birth के बाद mother can protect you only for so long. Mother can protect you only for so long. After some time you go out in the world. After you go out in the world, now आपको असली दुनिया परिचय होगा. What will happen? So there will be weird things will come. What that weird things? कोई लात मार के चला जाएगा, ठीक है, कोई धोखा दे के चला जाएगा. Someone will cheat you, someone will kick you, someone will praise you, right? Now after that, by looking at all of them, you are trying to adapt yourself exactly like that only. When you are followed by the exposure, that is the point, followed by the exposure, what you are going to get? What you are going to get? Very good. Followed by the exposure, you are going to get a memory cells. Memory cells. Because of these memory cells, you are developing a immunity that is only called as adaptive immunity. From the birth, mother हमेशा gift दिया है, so that is your birth. With the birth, what you are getting is your innate immunity. So with the birth, this is going to be very non-specific. For example, natural killer cell, for example, skin, all of these are doing what? They're least bothered about which is the pathogen here. They're trying to protect your body. Mother is also like that only, will try to protect you from everything, right? The same way, non-specific immunity protect you from virus, bacteria, even if physical factors also. But adaptive immunity is very specific, very specific. एक बार COVID आया था, your body has developed a memory. Now if you are exposed to the COVID second time, there is a high likelihood that your immune system will protect you. राइट, सो दैट इज योर अडेप्टिव इम्यूनिटी. सर ये सब पूछेंगे क्या? नहीं पूछेंगे, पर हमें समझ में आनी चाहिए ना, तो तब भी जाके हम लोग आगे जाके वी कैन बी एबल टू आंसर. नाउ व्हाट एग्जैक्टली द एग्जामिनर इज इंटरेस्टेड हियर? इनेट इम्यूनिटी का सेल्स. Innate immunity का cells देखते हैं. The cells which are involved in the innate immunity, the most important ones are natural killer cell. Natural killer cell. So natural killer cell, sir अगर हमें image दे दिए, पहचाने कैसे? How do we find out? ठीक है. Natural killer cell is, if you consider this is a B lymphocyte and this is a T lymphocyte, this is going to be natural killer cell. Okay, so natural killer cell are larger than, this is MCQ, larger than your B and T lymphocyte. B and T lymphocyte. Okay, now they have a cluster differentiation marker. Cluster differentiation marker 16, not 15, not 15, but rather it is going to be your 56. It is your 56. Remember, 56, not 15. 15 नहीं है, 56. Okay, और 52 भी नहीं है, 56. Okay, so 16 and 56, all the sixes are natural killer cell. So basically they are going to provide you a cell mediated immunity. Okay, then there is one more thing called as pattern recognition receptor. Pattern recognition receptor, they work with the help of two important aspects. What is that? That is two important factors that is based on the pathogen, that is based on the pathogen, and one more thing based on the immune cell. Based on the immune cell they are going to work. So a pattern recognition receptor के अंदर क्या हमें समझ में आनी चाहिए? The classic example for a pattern recognition receptor. So in the cells we have one type of receptor, they recognize the patterns. मतलब अच्छा ये पैटर्न में आया तो ये स्टेप्लोकोकस था, हाँ ये स्ट्रेप्टोकोकस था, ये पहचान लेगा. ठीक है, तो उसका क्लासिक एग्जांपल है टोल लाइक रिसेप्टर, TLR, called as toll like receptor. टोल लाइक receptors. ओके, ये टोल लाइक receptor के अंदर ना फैमिलीज है. टोल लाइक receptor has families. For example, TLR class 2 will recognize what? TB, sir. TLR class 3 will recognize what, sir? Class 3 will recognize DNA or RNA virus. DNA or RNA virus. Okay, sir, how to remember? देखो भाई, ध्यान, attention is very important key here. TLR2, TB दो अक्षर का है, 2 letters. TLR3, DNA and RNA virus. Okay, remember these two families at least. TLR के अंदर सब families है. So family number 2, family number 3. Family number 3 will recognize DNA RNA virus. Family number 2 will recognize TB virus. Bas. Okay, then we have a adaptive immunity. Adaptive immunity will have your B lymphocyte. All of you know that B lymphocytes are produced in bone marrow. They are produced in bone marrow. Maturation also occurs in the bone marrow. But what I want to teach you people, we have a B lymphocyte. We have a B lymphocyte. Now B lymphocyte, whenever this fellow is activated, this B lymphocyte will go and form somebody called as a plasma cell. Called as a plasma cell. If there is a tumor of the plasma cell, that is what I taught you people in orthopedics. उसी को क्या बोलते हो भैया? उसी को बोलते हो, हाँ क्या बोलते हो? Multiple myeloma. Okay, plasma cell. But if in a normal person, plasma cell will get activated. Now this plasma cell will go and produce gamma globulin, also called as immunoglobulin. Gamma globulin, which is also called as immunoglobulin. So first ever immunoglobulin to be formed is kaun sa? पहला पहला बनेगा इम्यूनोग्लोबुलिन एम। तुम कुछ भी कर लो, डू व्हाटएवर यू वांट, द फर्स्ट इम्यूनोग्लोबुलिन यू आर गोइंग टू गेट इज आईजीएम। ओके, ये बहुत बड़ा सा मॉलिक्यूल होता है, a large molecule. Now this immunoglobulin M will undergo a process, this is the MCQ, will undergo a process called as class switching, sir. Class switching will undergo a process called as class switching. सर m को कैसा याद रखे? वेरी गुड, m फॉर मिलियनियर, यू कैन रिमेंबर इट एज ए मिलियनियर मॉलिक्यूल, लार्ज इम्यूनोग्लोबुलिन, ठीक है। क्लास स्विचिंग होता है, आफ्टर क्लास स्विचिंग विल अकर, इट विल क्रिएट आईजीजी। वाह, आईजीजी आता है क्या से? आईजीएम से। देन इट विल आल्सो क्रिएट, फर्स्ट इम्यूनोग्लोबुलिन आ गया क्लास स्विचिंग की वजह से, ओके। सेकंड इम्यूनोग्लोबुलिन, फॉर एग्जांपल आईजीई, ओके, देन यू आर गोइंग टू गेट आईजीडी, okay. All the immunoglobulin, even your IgA, all the immunoglobulin come from mother of immunoglobulin, immunoglobulin M, okay. So इसीलिए during the acute inflammation, आप सोच के देखो, acute inflammation होता है, inflammation has just started, immunoglobulin M will be the first one you will get. You found the reason? बस रटे जा रहे हो, रटे जा रहे हो, खाए रटना है, बहुत सिंपल, रिवीजन में इतना समझ लो, ठीक है। then if there is a chronic inflammation, then your IgG, है ना, IgE means allergy, IgE means allergy, मतलब anywhere you find IgM, acute inflammation. For example, there is a increase of IgG and also IgM, इसका मतलब क्या होगा? Again, still it is acute inflammation only, because M can be getting converted into what? M can be getting converted into what is that? G. So the rule is, if M is elevated, rule is very simple, acute infection. कहानी खत्म, ठीक है। For example, if there is a failure of class switching, if there is a failure of class switching, class अगर switch नहीं होता है तो क्या होगा? If there is a failure of class switching, so automatically there will be no conversion. If there is no conversion, there will be increase of IgM. इसी को बोलते हो हाइपर IgM syndrome भैया, इसी को क्या बोलते हो? हाइपर IgM syndrome. This itself is called as hyper IgM syndrome. Hyper IgM syndrome, what you are going to find is increased level of IgM and a decreased level of, in the hyper IgM there is an increase of IgM level, and also there is a decrease of IgG. If there is a decrease of IgG, automatically immune system is compromised, so that is what I am trying to tell you. Got the point? Okay. Now T lymphocyte, B lymphocyte. Now, my dear students, B lymphocyte, remember their marker is CD19 and T lymphocyte is your CD3. Okay, see, T lymphocyte is your CD3, and T lymphocytes are responsible for cell-mediated immunity. So cell-mediated immunity matlab they are going to take the help of somebody called as a helper cell, called as a T helper cells, Okay, let's go to the next one, MHC. Now MHC क्या होता है? अरे MHC बहुत सिंपल है, मेजर, किस चीज का स्ट्रक्चर नहीं पूछते यार, कौन सी स्ट्रक्चर पूछते? कभी नहीं पूछते। स्ट्रक्चर पूछेंगे तो भी एक हिंट देता हूं, याद रखो, अगर मल्टीपल सेल्स आर प्लेइंग इन द इमेज, मल्टीपल टी लिम्फोसाइट गेम खेल रहे हैं, वो हाईलाइट नहीं किया पर एक ही तरीके का मल्टीपल सेल दिख रहा है, वो टी लिम्फोसाइट्स। एक सेल था, दूसरे सेल बना, उसके बाद इम्यूनोग्लोबुलिन का पिक्चर दिया, वो हमेशा बी लिम्फोसाइट। सिंपल। अब यही तो चाहिए था तुम्हें 5 दिन पहले एग्जाम के, मिल लिया। चलो लेट्स गो। MHC मतलब मेजर histocompatibility. Okay, what is major histocompatibility? Are also called as HLA, human leukocyte antigen. This is a system which will help us differentiate from the own body to the other cells. Okay, how do we have own body to other cells? So we have MHC1 and MHC2, major histocompatibility complex 1 and major histocompatibility complex 2. So major histocompatibility complex 1 is present in all the nucleated cell. Matlab these MHC1 are present in all the nucleated cells and platelets. Matlab MHC is absent in RBC. Okay, MHC2 is present only in the antigen presenting cells. Antigen presenting cells like skin के अंदर होता है. Skin के अंदर you have cells called as Langerhans cells or Langhans cells. Langerhans cells. Langerhans cells. Okay. For example, in the liver we have Kupffer cells. Kupffer cells. Okay. For example, we have other places. For example, in the lung we have what is that? Alveolar macrophages. So wherever antigen presenting cells are there, उनके ऊपर होता है MHC2. In all the nucleated cells होता है MHC1. So MHC1 helps in detection of what? If there is a cell, right? If the antigen is inside the cell or outside the cell, two possible. If it is inside the cell, intracellular antigen can be detected by MHC1. MHC2 will help us detection of extracellular antigen. Okay. Now MHC1 is a types. MHC type 1 type, like MHC1 has three types. MHC1 has A, B, C types. MHC2 has two letters, DP, DQ, DR. Okay, MHC2 two letters. Okay. Now चलो मान के चलते हैं वो there was one cell. There was an antigen. Inside the cell there was an antigen. Now this antigen was recognized by whom? MHC1. Now MHC1 recognized this fellow is a foreigner to me. Now whom will he go and now this MHC1 will go and give this antigen. तो antigen को लेके जाएगा and to what is that called as a CD8 T cells, CD8 T cells, CD8 TH cells. So very simple. Yeah, मान के चलो MHC is there, is recognizing the antigen. If it recognize the antigen inside the cell, it will go and activate CD8 cell. अगर बाहर का MHC2 is activated, it will activate CD4 cell. ओके तो इसको याद रखने का तरीका कैसा? सो रूल ऑफ 8 बना, रूल ऑफ 8. ओके सो 8 ones are 8. Okay, so CD8 and this one will be your MHC type. Okay, then CD4. Okay, so automatically CD4 multiplied by it will be triggered by MHC2. तो इसका again बना कितना 8. तो इसको याद रखो, रूल ऑफ 8. बात खत्म. ये कोई टेक्स्ट बुक का रूल नहीं है, संविधान का रूल नहीं है. ओके, दिस इज नॉट अ रूल ऑफ टेक्स्ट बुक, इट इज अ टेक्निक टू रिमेंबर. ओके हो गया. which MHC will activate which helper cells. Okay, let's go to the last concept, hypersensitivity. Hypersensitivity can be divided into 4 types. Very simple. अगर मान के चलो I'm going out in the road. Now I'm exposed to some dust. As the dust comes, I will sneeze. But another friend of mine can get asthma. There is two people. We are walking same. We are exposed to the same antigen, but he's getting asthma. I'm just getting a sneeze. Right? For him, the immune system is over responsive. Exaggerated response of the immune system for him. So this exaggerated response of the immune system is only called as hypersensitivity. Now hypersensitivity can be divided into types. So that is your type 1. Now I'm not going into the mechanisms of each hypersensitivity. I will tell you the very important points. Okay, so the most important point is that बहुत simple सी बन रहा है. So you have first exposure to the antigen. मतलब क्या हुआ, एक बार एंटीजन आया तो your body will produce IgE. ठीक है, पॉइंट नंबर 1, which immunoglobulin प्रेशर होता है. Now ये IgE क्या करेगा, एक mast cell होगा, this is a mast cell. तो इसके ऊपर जाके what will happen on this mast cell, what will happen, IgE will sit. Okay, now this process is only called as antigen sensitization. Now we will have a second exposure. So automatically mast cell is sitting with the IgE. Second exposure, antigen comes and binds. Automatically it will break the mast cell. Release the histamine. Okay, so if there is a release of histamine, automatically based on the amount of antigen, there will be reaction. So what are the important key players? IgE and also histamine. Histamine is produced with cell, mast cell. Okay, classic examples, we have asthma. Now asthma can be of multiple types of hypersensitivity. It can come under type 1 also, it can come under type 3 also, depends on the type of asthma. Okay, asthma, anaphylactic reaction. Okay, This is your type 1 hypersensitivity. Then let's talk about your type 2 hypersensitivity. What is this type 2 hypersensitivity? तो type 2 के अंदर बहुत सिंपल है यार, type 2 के अंदर बहुत सिंपल है type 2. So type 2, so type 1 can also be called as anaphylactic reaction. Okay, type 2 is called as antigen antibody reaction, antigen antibody reaction. Okay, are also called as antibody mediated cell cytotoxicity. इसके अंदर क्या होता है, तो एंटीजन जो होता है ना, whatever antigen is there, it is fixed means we know the target is fixed here. So not like blindly anywhere mast cell will get activated, ऐसा नहीं होता. Okay, but here antigen is fixed. Okay, antigen is fixed. Okay, and now there is an antibodies produced. Okay, for example, we have antigen. Let's write the antigen and antibody, right? So if the antigen is a glomerular basement membrane, so which antibodies will be there? Specific antibodies, anti-GBM, anti-glomerular basement membrane antibodies. Done, sir? Okay, then we have, for example, what will be there? There is what is that? That is your, for example, in the condition called as rheumatic fever, rheumatoid arthritis nahi hai, rheumatic fever. Okay, rheumatic fever, what will happen? The antigen is your heart के अंदर specifically which one? M protein of the heart, and your own antibodies, auto antibodies from the body. So it is going to target only specifically M protein. So if you notice here, the specific target is fixed, right? For example, you have, what is that? NM receptor, auto antibodies. So NM receptor का auto antibody specifically destructive type. So here if you notice, here antigen can be cell, antigen can be protein, antigen can be receptor. but कोई एक चीज का स्पेसिफिक होता है. If the antigen is a receptor, antibodies are specifically produced to NM receptor, seen with which disease? Myasthenia gravis. Okay, for example, you have TSH receptor as an antibody, you have long acting stimulatory antibodies, that is only called as long acting stimulatory antibodies, called as LATs. Okay, so these LATs antibodies are seen with the Graves disease. So इसके अंदर बहुत सिंपल सी फंडा है, अगर एंटीबॉडी वेरी स्पेसिफिकली टारगेटिंग समबडी, बस मैं तेरे को टारगेट हूँ, तो बात खत्म हो गया. दैट इज योर टाइप 2 हाइपरसेंसिटिविटी. नाउ टाइप 3 हाइपरसेंसिटिविटी, कहानी क्या होता है पता है? टाइप 1 2 3 के अंदर टाइप 3 ना बहुत सिंपल फंडा है, टाइप 2 का थोड़ा गलत हो गया. टाइप 2 is going to take little bit deviation. Okay, then starts type 3. What will happen? Antigen आएगा, antigen is there in the body, antibody is produced. Now antigen and antibody together we call it as a immune complex. Now this immune complex usually stimulate a complement system. Now this complement system will go and stimulate, what is that? Macrophages. Now macrophages destroy the antigen. So this is what happens in type 2 also. But exactly if this fails, immune system failed to remove the immune complexes, then it will lead to type 3 hypersensitivity. बस बात. Okay, तो टाइप 3 हाइपरसेंसिटिव के एग्जांपल्स. सो अब क्या होगा? एंटीजन एंटीबॉडी कॉम्प्लेक्स सर्कुलेशन में चले जाएंगे, वो पागल जैसा घूमते रहेंगे. अरे भाई मुझे कोई निकालो यहाँ से, कोई निकालने वाला नहीं है, बस घूमे जा रहे हैं. He is telling please remove me, but nobody is there to remove, so that will go on and on and on, right? So it will circulate and it will get filtered. Filtered where? Filtered in a high pressure areas. High pressure areas like what? High pressure areas like joints. अगर joints में filter हो जाएगा तो arthritis. For example, it will get filter into glomerulus. If it get filtered into glomerulus, glomerulonephritis. So examples are very easy: rheumatoid arthritis, reactive arthritis. When do you see anybody reactive arthritis? Reactive arthritis is a symptom of a syndrome. It is a part of a syndrome. Tell me, can anybody quickly? Let's see. I'll wait. ट्राई इट्स ओके गलत बोलने से कोई दिक्कत नहीं, अभी एग्जाम से पहले ही है, अगर गलत बोल भी दिया मैं सही करूंगा। reactive arthritis is a symptom of, अरे कमान यार, that is only called as Reiter's syndrome, called as Reiter's syndrome, Reiter's syndrome, Reiter's syndrome, ठीक है। हाँ हाँ, Reiter's syndrome। यार Reiter's syndrome के अंदर ना 3 चीज होते हैं, ठीक है। what are the 3 things? arthritis भाई, क्रोक 2 से ज्यादा इंटरेस्टेड, इट्स ओके माय डियर, इट्स फाइन, arthritis, okay, so croak 2 से more important in MCA exam, okay, arthritis, conjunctivitis and urethritis, okay. Now it is usually followed by sexual intercourse, okay, sexual intercourse। अरे ये बहुत सिंपल सी बात है यार। see, when patient has sex with a person who is having what is that chlamydia urethritis, okay, तो क्या होता है, so मतलब you know what, he had a sex, so he took pleasure and exactly he is now suffering from a pain, okay, so he saw things which he shouldn't have, तो conjunctivitis, okay, किया उसने कुछ जो नहीं करना था, तो arthritis, physical। सो दिस 3 प्लेसेस देयर विल बी रिएक्टिव आर्थराइटिस, ठीक है। अब मुझे पता है ये चीज को ना आप लोग कैसा फैलाओगे, ठीक है। तुम जैसे भी फैलाओ बात, मुझे वो फर्क नहीं पड़ता है। आई एम इंटरेस्टेड इन हाउ मच यू रिमेंबर, okay, so let's look here: arthritis, conjunctivitis, urethritis, okay, so that is your reactive arthritis and rheumatoid arthritis, okay। then you have diseases like HSP, henoch swollen purpura, वो पुरपुरा नहीं होता है, purpura, okay। then also in the systemic lupus erythematosus, okay। अरे गुड इवनिंग डॉक्टर साहब, कैसे हो? चलो, लेट्स गो टू द लास्ट टाइप ऑफ hypersensitivity, type 4 hypersensitivity, type 4 hypersensitivity। वेरी गुड इवनिंग, वेरी ग्लैड टू सी यू, ओके। तो चलिए डॉक्टर जगस्वीश नोई, वेरी ग्लैड टू सी यू ब्रदर। सो टाइप 4 हाइपरसेंसिटिविटी, वेरी सिंपल। टाइप 4 हाइपरसेंसिटिविटी ना, ये आराम से मतलब यू नो लड्डू खा के सो रहा है, ठीक है। अरे आज नहीं तो कल कर लेंगे, ठीक है, आराम से सो जाएंगे, ठीक है। सो बेसिकली हियर आई एम टेलिंग यू इज दैट दिस इज a cell mediated, okay, slow onset. This is cell mediated slow onset, okay. This is the most important aspect, okay, this is the most important. In HSP I will teach you during vasculitis, आज ही पढ़ाऊंगा, ठीक है। slow onset, so for example I was applying a cream for last 10 days, now I'm getting allergic reaction, okay, anything, for example your very good tuberculin test, okay, you have Brucellin test, okay, Brucellin test, or for example you have your lepra reaction. Why lepra reaction is also very interesting. Lepra reaction, which lepra reaction? Type 1 2, type 1 2 lepra reaction। तो रिमेंबर lepra reaction type 1, lepra reaction। तो ये lepra का भी पढ़ा देता हूँ। so there is something called as lepra reaction, so lepra reaction has a type 1 and type 2, and in these hypersensitivity is there, hypersensitivity is very simple। so hypersensitivity is lepra reaction type 1 is your type 4 hypersensitivity। मतलब टाइप 1 लेप्रा रिएक्शन कौन सी टाइप की रिएक्शन होता है? टाइप 4 हाइपरसेंसिटिविटी रिएक्शन, ठीक है। अब ये टाइप 2 विल बी योर टाइप 3 हाइपरसेंसिटिविटी। तो यू कैन रिमेंबर इट लाइक रूल ऑफ 5, किसी को भी जोड़ो 5 आनी चाहिए, तो वही टाइप ऑफ हाइपरसेंसिटिविटी आएगा, तो लेप्रा रिएक्शन का आंसर निकल गया। ठीक है, अब एक था रूल ऑफ एट, एक हो गया रूल ऑफ फाइव, ठीक है। So with this being said, we will put an end card for what? For only general pathology. Then we will study your hematology. Then I will teach you your vascular and some images. Okay. Only then we'll be able to complete it. Okay. So with this much being said, let's take a break of 15 minutes. Okay. So let's start by your 7:10. Okay. 7:10 we will be back by 7:10. We'll come back by 7:10 and then we will do hematology. Now hematology is not going to be like that. We are going to take a new approach called as clinical case scenarios. Okay, the lengthiest possible clinical scenarios. अगर इस चीज को हमने सॉल्व कर लेना, वो कुछ भी दे दे हमारा सॉल्व हो ही जाएगा ऐसी वाली. Then followed by that some images. Good. चलिए take a break. I'll come back. Hello, everybody. Hello, everyone. I'm back. Am I audible? Just let me check once if I'm audible or not. हाँ, ये बहुत इंपॉर्टेंट टास्क होता है ड्यूरिंग द टाइम ऑफ ए लाइव, ओके? क्योंकि अगर मैं पढ़ाने लग गया एंड यू पीपल डिडंट फॉलो दैट ऑडियो वीडियो इज नॉट देयर एंड तुम्हें मतलब कंटिन्यूटी मिस हो जाता है। नाउ एनीवेज, चलिए आगे बढ़ते हैं, लेट्स कंटिन्यू। सो but before going into the class, and I really forgot to wish you all a happy Makar Sankranti, happy Lohri, and happy Pongal, happy Vishu. So we all have the same festival all over India, but with the different names. Makar Sankranti, Pedda Panduga, different names. Okay, for everyone, wish you a happy Lohri, happy Sankranti, happy Vishu, happy Pongal, and I'm sorry if I can't remember the names of some parts of India where the festival is named differently, but I think pretty much the concept is same, right? तो चलिए हेमेटोलॉजी शुरू करते हैं, है ना? तो हेमेटोलॉजी ना बहुत इजी होता है। सब लोग बोलते कि सर यही यही बोल के ना हमें मतलब तुम बस कहानी बोलते रहो, ऐसे बोलते रहना, क्यों कैसे इजी होते हैं? अरे भाई, हेमेटोलॉजी जितना इजी मुझे लगता है कि एफएमजी के लिए कुछ और चीज नहीं है, स्पेशली फ्रॉम पैथोलॉजी। ठीक है, मैं मजाक नहीं कर रहा हूँ यार, मैं मजाक नहीं कर रहा हूँ, बहुत बहुत इजी चीज होता है। ठीक, तो चलिए शुरू करते हैं। सो एवरीबडी बैक, शैल आई स्टार्ट? हाँ या ना तो बता दो यार, थोड़ा मैं शुरू करने के लिए तो ग्रीन सिग्नल मिल जाए मुझे। And for some comments I replied with from my other channel. That's it. Okay, but yeah, okay, so let's okay, perfect. Listen to me. A 55-year-old man present to his primary care physician with the complaints of fatigue. Okay, hemoglobin 9 gram per deciliter means hemoglobin is reduced. Hemoglobin normal level is more than 12. Hemotitrate is 27%, that is also reduced. Leukocyte count is 2500. Okay, a biopsy of the bone marrow is performed which demonstrate hypocellular and peripheral smear is given like this. Okay, what is the most likely diagnosis? So first and most important, let me establish some facts for you. So what is that? WBC count, leukocyte count, or total leukocyte count, normally which will vary from 3000 to 11,000. 3000 to how much? 11,000. Okay, so now all the WBCs come from where? Consider from the bone marrow. So bone marrow is responsible for the production of all WBCs. Okay, now in the bone marrow biopsy, it is telling you what? Telling you hypocellular means hypocellular means there is a decrease of cells in the bone marrow. If there is a decrease of cells in the bone marrow and peripheral smear is showing like this as a given picture. In the given picture, if I zoom in and notice very carefully, there are some important cells which are looking like this. If you look at these cells, they are looking like a drop of a tear. They're looking like a drop of a tear. Okay, so what is the answer? Very good, your answer is absolutely correct. The answer is myelofibrosis. So first and most important, the image what we are getting here is teardrop RBC, teardrop RBC, teardrop RBC. So teardrop RBC and also hypocellular. Consider, if you consider this is a bone, right? Now inside the bone, what is there? Bone marrow is there. If instead of bone marrow, I will fill it with connective tissue. Instead of bone marrow, I will fill it with connective tissue. If there is a connective tissue, automatically आप लोग क्या करोगे? Bone marrow biopsy के लिए क्या किया? Needle घुसा. ठीक है, but what is there? Fibrosis there. So since fibrosis there is no cells can be found, so total leukocyte count will be reduced. So basic rule is that in the bone marrow, if there is a fibrosis, you are going to get something called as a dry tap on bone marrow. मतलब needle तो लगाया आपने bone marrow के अंदर, but you are not able to aspirate anything called as a dry tap. Okay, if there is a dry tap found on the bone marrow or hypocellular bone marrow with a reduced total leukocyte count, it is clearly telling you fibrosis in the bone marrow called as myelofibrosis. तो आपको क्वेश्चन आएगा, सर myelofibrosis is caused by what? Listen to me, my dear students. Myelofibrosis is a disease which is as a result of, it is a complication of It is a complication of osteomyelitis. Osteomyelitis का मतलब क्या होता है? Osteomyelitis का मतलब is very simple. Osteo मतलब bone, myelitis means marrow, itis means inflammation. So bone marrow inflammation. Inflammation के बाद क्या होगा? हाँ, पैथोलॉजी का रूल क्या था? इन्फ्लेमेशन फॉलोड बाय हीलिंग. हीलिंग के बाद क्या होगा? फाइब्रोसिस हो गया तो आरबीसी के अंदर मतलब बोन मैरो के अंदर सेल्स बनेंगे कि नहीं बनेगा? नहीं बनेगा. एंड इफ यू फाइंड यू आर गोइंग टू गेट दिस टाइप ऑफ टीयर ड्रॉप आरबीसी, ड्राई टैप, हिस्ट्री ऑफ ऑस्टियोमाइलाइटिस एंड एंड टोटल ल्यूकोसाइट काउंट रिड्यूस्ड इज अ डायरेक्ट इंडिकेटर ऑफ माइलोफाइब्रोसिस. ये अलग सा टॉपिक होता है, ये कहीं पे भी पढ़ाया नहीं जाता है, तो इसलिए मैं इसको पहला क्वेश्चन लगा दिया. So this is the reason I have kept it as a first question. Then many places it is missed and many people will lose the concept itself. Isliye. Okay. Let's go to the next one. Okay. Look here. Physical examination revealed a thin, well-appearing boy with a conjunctival pallor. Conjunctiva is pale. Okay. Peripheral blood smear, which is shown in the image. So peripheral blood smear is like this. Okay. Now, which of the following is the most likely cause of the finding on the blood smear? So what they're asking? So look at the blood smear and answer the following. What is the likely cause? Okay. Now, if you look at this, first and most important, he's a pale, well appearing boy with a conjunctival pallor with a peripheral blood smear shown like this. Okay. Now what exactly I'm trying to tell you, if you look at this, so very carefully, now you are telling what is that? B12 deficiency. B12 deficiency is not a correct answer. Why? Because there is no hyper segmented neutrophil. There is only 2 segments in the neutrophils nucleus, so we are going to rule that out actually. Okay. So answer क्या होगा मैं समझाता हूँ, मैं हूँ ना, समझाता हूँ. सुनो. So what happens is that this is first and most important. It is a supravital stain. Supravital stain. On the supravital stain, you are finding this peripherally located. There what? Peripherally located. What is that? Very good. Haynes bodies. They are your Haynes bodies. Haynes bodies are peripherally located. Haynes bodies. So if Haynes bodies are there, the best answer is your G6PD deficiency. I'll tell you what is G6PD deficiency. Listen to me. G6PD deficiency, I will explain it here only. So we have some substance called as glutathione. We have something called as glutathione. Now glutathione, my dear students, what will happen? What will happen is that peroxidation. Okay, peroxidation. So during this peroxidation of glutathione with the help of an enzyme called as, very good, which we discussed in the earlier, glutathione peroxidase. Okay, so it will remove H2O2, okay, and it will make it into water. Okay. Now glutathione, once it undergoes, we have something called as glutathione oxidized. Okay. Now this oxidized glutathione will undergo a reaction called as reduction reaction. Okay. For this reduction, we require a substance called as NADPH. Okay. So NADPH बनने के लिए, for the NADPH synthesis, we require an enzyme called as G6PD. After reduction, there is a reduced glutathione. Okay, simple as that. So if there is no G6PD, no NADPH. If no NADPH, no reduced glutathione, so there is no peroxidation. No peroxidation means automatically there will be increase of H2O2. If there is the increase of H2O2, this H2O2 is what? Free radical. It will form peroxide bodies in the RBC. These peroxide bodies are only called as a Haynes bodies. Okay. Now these Haynes bodies, my dear students, look at this. If you consider this is one Haynes body, this Haynes body can be removed by your macrophage, leading to creating your something called as bite cell. ऐसा दिखेगा कि some bite of the RBC has been taken out. Okay. So G6PD कहाँ पे game खेलता है? Very good. That is HMP shunt, pentose phosphate pathway. Okay. So listen to me very carefully. We'll get a cells called as a bite cell. So bite cells, Haynes body, is an indicator of your G6PD deficiency. Now G6PD deficiency people usually will not have any symptom. They will get the symptom only when there is what? Very good. There is a precipitating factor. So the factors which increase the symptoms of G6PD are old anti-malarial drugs. I'm repeating again, ध्यान से सुन लो. अभी 5 दिन का टाइम है, एक बार सुन भी लोगे याद हो जाएगा. तो if any patient has a G6PD deficiency, इसके अंदर remember very clearly G6PD deficiency. So patient will be asymptomatic healthy if he gets a inflammation, if he takes a sulfur containing drugs, if he takes a old anti-malarial drugs, what will happen is that H2O2 normal से ज़्यादा हो जाएगा, automatically it will lead to what? More of RBC lysis leading to jaundice. So remember the factors which increase the symptoms of G6PD are called as precipitating factors of G6PD. That includes old anti-malarial drugs, inflammation, and your sulfur containing drugs. Understood everybody? And it is a genetic symptom. It is a genetic condition. Means if elder brother has a G6PD deficiency, high likely that younger brother can also get it. Okay, the best investigation of choice. Sab log peripheral smear, everyone will write this and come. No, peripheral smear is not the correct answer. The investigation of choice is G6 PD assay, G6 PD assay. Okay, this is the best investigation. तो इसका treatment क्या करे भाई? If you are getting problem because of somebody or something, stay away from them, right? Like that only. If you are getting G6PD symptoms by taking old anti-malarial drugs or getting inflammation, stay away from that. That's it. Remove the triggering factor. Finish हो? Finished? हो गया? समझ में आ गया? Very good. हाँ या ना बताओ, फिर आगे बोलो. मैं खुद पे वेरी गुड बोल के आगे चला जाऊंगा तो दिक्कत. Understood? Okay. Perfect. Now let's continue to the next question. ऐसा क्वेश्चन देखने से ना ओ भाई क्या कर रही, इतना बड़ा क्वेश्चन है, टेंशन ना लो, मैं हूं ना, ठीक है. See, whenever you get this kind of question, पहले thing is that first thing is that you should confirm that okay, definitely we will get this question correct. Why? The reason is like this. The reason is, my dear students, इसके अंदर detail बहुत है. The details are very many. Okay, the examiner is giving so many details that तुम लोग गलत करने का possibilities are reduced because एक details नहीं तो दूसरे details से will pick it up. ठीक है? अच्छा, very nice. Let's start with the discussion. 35-year-old woman has been feeling fatigued, okay, over the past few months. History of menorrhagia. Okay, since she was about 18-year-old. Okay, her blood count is significant for hemoglobin of 10.8. It is a very mild case of anemia. Okay, mean corpuscular volume is 73 and iron studies show low ferritin with increased TIBC. Our peripheral smear is shown below. What is the likely cause of anemia? So first and most important here, what and all I'm trying to tell you people. So normal MCV, normal mean corpuscular volume. Okay, normal mean corpuscular volume is 80 to 100 FL. Okay, if less than 80, that is only called as microcytic anemia. Microcytic anemia, most commonly two places where you are going to get in exam: iron deficiency anemia and thalassemia. Iron deficiency and thalassemia. Okay, and if there is a more than 100, it is called as macrocytic anemia. Macrocytic anemia. Now macrocytic anemia usually due to what? Macrocytic anemia usually due to vitamin deficiencies. Such as B9 and B12. Okay, so this is a point to be remembered. Now when I'm talking about this, please listen to me very carefully here. So I know that most of you are watching from your app and putting the attendance here, but focus. So iron deficiency anemia can be caused by three major causes. Cause number one, iron deficiency anemia itself, means nutritionally I'm not taking sufficient iron. Okay. Point number two is what? Point number two is that this can also be caused due to anemia of chronic diseases. Matlab, if there is a chronic inflammation can also lead to anemia. Now, iron deficiency anemia can also be caused by chronic blood loss. Okay, chronic blood loss and IDA are same. Chronic blood loss and IDA are same. Okay. Now in this female, we have two things to be differentiated: whether it is an anemia of chronic disease or anemia of chronic disease or chronic blood loss or iron deficiency anemia. So how to differentiate it, sir? So remember, I will teach you a technique. So till the exam, this technique is sufficient for you people. Remember TIBC. TIBC नहीं, हिस्ट्री आपका भी जरूरत नहीं, हिस्ट्री भी नहीं दिया तो भी चलेगा. If history is given, very good. History of chronic inflammation is there, well and good. If that is not there, pass गया. ठीक है. So TIBC. Okay. So there is a decrease of hemoglobin. There is a decrease of hemoglobin. Okay. There is a decrease of MCV. Okay. And also you are going to find, if you notice here, I'll zoom it in. If you notice here, the RBCs have something like a look inside the cell. If you notice in the inside, it is looking like as if there is some target for you. Dark game target is there, like that target is there, right? So you are going to get a target cell. You are going to get a target cell. Target cell. Okay. Okay. Now all of these are an indicator of what is that? All of these are indicators of iron deficiency. So to differentiate, look at only one factor, that is your TIBC. TIBC if it is increased or TIBC if it is decreased. What is the answer? If TIBC is increased, that is the iron deficiency anemia. If TIBC is decreased, it is the anemia of chronic diseases. Point is over. Anemia of chronic diseases. Okay. If TIBC is decreased, anemia of chronic diseases. If increased, iron deficiency anemia, panda over. Okay. So very good. Anemia of chronic diseases. Remember, anemia of chronic diseases. Here you remember, this is due to a molecule called as a hepcidin. Due to a molecule called as hepcidin, it will inhibit somebody called as a ferroportin. It will inhibit somebody called as ferroportin. Ferroportin in the GIT का mucosa के अंदर there is a protein called as ferroportin. That ferroportin will be inhibited as a result of your hepcidin molecule. Hepcidin is a very important concept to be remembered. Anemia of chronic disease, TIBC decreased. Iron deficiency anemia, TIBC increased. Rest everything will be same. Okay. So the answer is what? Target cells is there. TIBC is increased. Increased TIBC. The answer is very good. Answer is iron deficiency anemia. Answer is A. Very good. Somebody gave the answer earlier itself. Very good answer. But I'm explaining this to everybody. Okay. Now, wow. Sir, ये क्वेश्चन कैसे सॉल्व करें? ये और भी सिंपल है भाई. Just look and wait. A 7-month-old baby present to the hospital with a paler abdominal distension. On physical examination, patient is found to have hepatosplenomegaly, frontal skull bossing. Hemoglobin electrophoresis revealed increase of HbF and HbA2. What is the most likely? So if there is a increased HbF and HbA2, the diagnosis is simple, thalassemia. Diagnosis is simple, thalassemia. Done, sir. If there is an increase of HbF and HbA2 and increase of fetal hemoglobin, thalassemia. Thalassemia is a type of microcytic hypochromic anemia. Okay. So let's look at the answer. Okay. Q Medical University. Very nice. Okay. चलो. अब आंसर बताओ. So microcytic and hypochromasia of the RBC. Answer will be C. Why? Very good, because it is a thalassemia. So remember, in normally in a healthy patient, normally types of hemoglobin. HbA is an adult hemoglobin. HbA1. Okay. Then we have HbF. HbF is a fetal hemoglobin. Fetal hemoglobin is decreased after birth. Immediately after the birth, fetal hemoglobin is drastically reduced. It is about less than 1%. If fetal hemoglobin is rising, HbA1 के अंदर क्या होता है? 2 alpha chain and 2 beta chains होते हैं. Okay. So if there is a deletion of 2 beta, only 2 alpha is there. Now these 2 alpha chains will combine with 2 gamma chains. 2 alpha and 2 gamma chains in the hemoglobin will give rise to HbF. Now HbF will cause all the other problems. So if there is an increase of HbF, that is a Confirmation of thalassemia. So what is thalassemia? Thalassemia is a disorder. Listen to me. It is a hemoglobin disorder in which what happens? It is a hemoglobin disorder in which the chains of the hemoglobin, yeah, alpha chains or beta chains will disappear. If alpha chain disappear, alpha thalassemia. If beta chain disappear, beta thalassemia. Okay, so in beta thalassemia में क्या होता है? Beta chains will be absent. Okay, only alpha chains are present. So two alpha chains will be combined with two gamma. Two alpha and two gamma is only called as a fetal hemoglobin. Fetal hemoglobin after the birth, which is of no use. If that is increased, that is your thalassemia. Thalassemia is a type of, what is that? Microcytic hypochromic anemia. Treatment, best treatment is recurrent transfusion. Right now the best treatment is recurrent transfusion only. Yes, gene therapy is being tried. Let's go to the next question. What is this? A 69-year-old man is brought to the emergency. He smells strongly of whiskey. Wow. Laboratory found to have a hemoglobin of 7, hematocrit of 21. Iron studies show an increase of free iron level. Peripheral smear obtained show the following image. Remember, my dear students, remember here what you're finding. This is a direct finding of what is that called as basophilic stippling. This type of appearance is called as basophilic stippling of RBC. So basophilic stippling of RBC is seen with B6 deficiency. B6 deficiency. It can be seen with lead poisoning. And also B6 deficiency can also be caused by two problems. One is alcohol. One more is isoniazid. Okay, so in this patient the best answer will be what? So blood lead levels, cobalamin supplementation, pyridoxine supplementation. Best treatment will be pyridoxine supplementation because he's a alcohol. There is a history of alcoholism. If there is a history of alcoholism, so we are suspecting alcohol causing B6 deficiency. So B6 deficiency caused by alcohol or isoniazid. In both of them you are going to get a basophilic stippling. एक बात याद रखो, basophilic मतलब bluish color में दिखता है. Anywhere basophilic मतलब bluish color में दिखते हो. Okay, so bluish color stippling like this, we call it as a basophilic stippling. अगर single body होता तो we might have considered what is that? Very good. That is your see, if single this thing is there, then you would have considered what is that? Very good. You would have considered a Haynes body. Okay. Now चलिए आगे बढ़ते हैं, थोड़ा आगे पीछे हो गया. Next point. What is that? B6 deficiency, my dear students. All of you know this much. All of you know. But one more point I would like to add you here. This is only called as this is a vitamin which can cause hyper and hypovitaminosis. दोनों का deficiency can mimic peripheral neuropathy. दोनों का symptom एक ही रहता है, hyper and hypovitaminosis. चलो, let's go to the next condition. Is a 12-year-old boy is brought by his parents to physician for a fever for the past 2 days. His temperature is 101. His medical history is significant sickle cell disease. Okay, look here, sickle cell anemia. So sickle cell disease के अंदर what is the complication? They are going to get a autosplenectomy. Okay, the recurrent infection. Year ago he underwent a spleen scintigraphy with a technetium 99M that revealed the functional hypersplenism. Means spleen is not working. So peripheral smear में क्या मिलेगा? What can you find in the peripheral smear when there is a hyposplenism? So to understand this, first let's understand normally during immature RBC, my dear students, look here, immature RBC. What is that? Immature RBC, there is a presence of nucleus inside the immature RBC. What is there? Nucleus is present. What is there? Nucleus is present. Nucleus कौन से color में होता है? Basophilic. Nucleus is a basophilic, bluish color में दिखता है. Okay, it will undergo maturation. Okay, RBC nucleus is removed. Nucleus removed by what? By spleen. Removed by spleen. Okay, spleen से remove हो जाता है. ठीक है, removed by the spleen. Okay, all right. Then we will get a reticulocyte. That reticulocyte becomes into RBC. This is the normal story. Okay. So now if there is no spleen, hyposplenism, if there is a hyposplenism, nucleus remove होगा कि नहीं होगा? No removal of nucleus, No removal of nucleus. If there is no removal of nucleus, the nuclear remnants will be there. Nuclear remnants will be present. So the nuclear remnants is only called as Havel Jolly bodies. Havel Jolly bodies are what? Nuclear remnants. तो कहां पे आएगा सर? ये कहीं पे भी आ सकता है, जहां जहां पे any condition where spleen is not working or spleen is removed. In all those conditions, we can get Havel Jolly bodies. So end stage of sickle cell anemia, we get Havel Jolly bodies. For example, we can get Havel Jolly bodies after post splenectomy. If there is a blunt trauma to the abdomen and spleen injury, if there is a spleen injury, that can also lead to what is that? Rupture of the spleen. If there is a rupture of the spleen, that time we might have to do splenectomy. If we remove the spleen also, again same story. What is the same story? Nuclear remnants will be present, called as a Havel Jolly bodies. समझ में आ गया? Very good answer. D is correct answer. I saw the answer. I was just explaining. You gave the answer very quickly. That's very good. Okay. A 29-year-old woman who is 16 weeks into her pregnancy comes to your office with the symptoms of fatigue, dizziness. She has been taking iron. On examination, she is having no neurological symptom. ये बात देखो, no neurological symptom. Okay. But her CBC is significant for hemoglobin 10.2. MCV is 105. If MCV is 105, that means she is having a macrocytes. Macrocytes are seen with two major conditions, benign or B12 deficiency. B12 deficiency will have neurological symptoms. Okay, neurological symptoms. Now, if neurological history is not given also, I will tell you technique to solve. Okay, her methyl malanoic level acid is normal. So one more thing is that she is having a 105 ml femtoliter methyl malanoic acid. Okay, methyl malanoic acid, my dear student, she is having normal. Okay, what is the likely diagnosis? Okay, let's look at the answer. The answer is already marked here. The answer is folate deficiency. Answer is what? Folate deficiency. Now, why folate deficiency? First and most important. Let's look at one by one. Okay, you look at the nucleus here. Okay, so nucleus, if you look here, so nucleus of the neutrophil. Inside the neutrophil, you look here, segments. I will show you with the black color. Look here. I'll tell you why not see. So one segment, another segment, another segment, another segment, another segment. If there is more than 4 to 5 segments, we call it as what, my dear students? What is that called as? Remember, that is only called as hypersegmented neutrophil. Hypersegmented neutrophil. This is a very favorite question of exam. Hypersegmented neutrophil. Hypersegmented neutrophil again tells you what is that? Hypersegmented neutrophil again tells you it can be benign or it can be B12. Sir, how to confirm which is the answer? The answer is definitely B12, folate, benign, that is folate deficiency. How exactly? Remember, in the benign and B12 deficiency, there will be increase of homocysteine, but always normal methyl malanoic acid. Okay, so this is from the biochemistry you should have studied. So homocysteine metabolism requires both B9 and B12, but if there is a B9 deficiency, only elevated will be homocysteine. Okay, but if there is a B12 deficiency, folate, yes, it will cause a neurological defect in the fetus, not in the mother. That is a point to be paid attention. Though it will cause a neural tube defect. In the B12 deficiency, there will be increase of homocysteine, and also there will be increase of methyl malanoic acid. ये point याद रखा करो. Methyl malanoic acid and homocysteine both are elevated in B12 deficiency. Okay, clear everybody? If both are elevated, इसको भी याद रखा करो. Though two things are elevated, it is having 2 digits here. Okay, so the answer is folate deficiency. So here only I have told you people, in decrease of folic acid, there is an increase of homocysteine, normal methyl malanoic acid, unlike B12 deficiency, which has increase of methyl malanoic acid. Clear? Okay. Let's go to the next important point here. A 5-year-old boy was diagnosed with a urinary tract infection, provided with a medication few days ago. On examination, patient has a normal vitals but has a mild jaundice. His mother states that her brother had similar episode when he was treated for malaria. Wow, look here, look here, look here. 5-year-old boy, okay, he's getting what is that? Jaundice. After treating with a medication. And his brother also had the same thing when treated for malaria. Wow, it sounds similar. Look here. In which condition? Yes. After taking treatment for malaria, if he is getting jaundice, it is a high likely. What is that? Very good. The answer is G6PD deficiency. Okay. So both can have this disease. Both can have. Urinary tract infection is a stressful condition where there is an increase of free radical. There will be automatically free radical increase and hemolysis. Remember, after taking, see here, brother is having same symptom when treated for malaria, and now small brother is having the same symptoms when he was treated with the UTI. Simple as that. We have given as a result of UTI itself, inflammation will cause increase of free radical. So increased free radical causes jaundice, means that is direct answer is G6PD deficiency. You get my point? Okay. A 3-year-old boy is seen at a annual pediatrician visit with the concern for the prolonged nosebleed. Ever since he was about 2 years old, he has multiple episodes of nosebleed that can be stopped only after hours. On physical examination, okay, on physical examination, right elbow is slightly swollen and tender on palpation. On further question, promptly had an unexplained bleeding in the maternal ankle. Lab result revealed increase of APDT that corrects after mixing studies. Okay, so what is the diagnosis? Yeah, simple here. Look at this. If there is a APTT increase, that is showing intrinsic pathway defect. Okay, intrinsic pathway defect, only what is there? Very good. Only which factor among this is intrinsic, and among which that is your, what is that? That is your hemophilia. This is a hemophilia A. Hemophilia A. The treatment is your FFP, fresh frozen plasma. Treatment is a fresh frozen plasma. Remember, for the hemophilia A, it is a factor 8 deficiency. Factor 8 deficiency, that is your treatment is FFP. Okay. Let's continue to the next aspect. What is that? So here we have some important diseases I wanted to teach you people, but again this will be discussed for you people from your pharmacology side. But anyways, during the platelet disorder, so during the platelet disorders, let's talk about few of them. Okay, what happens? What is this full picture? I'll tell you what to remember. Okay, don't remember the whole thing. Now there is a damage to the blood vessel. If there is a damage to the blood vessel from the endothelium, there is a von Willebrand factor. This von Willebrand factor will bind with the platelet's GP2B receptor. Okay. Now this platelet will get activated. It will attract other platelets. One platelet will bind with another platelet with the help of GP2B3A receptor. Means during the time of bleeding, platelet aggravation will occur. For the platelet aggravation, first thing is that platelets has to get attached to the vessel wall with the help of von Willebrand factor. Von Willebrand factor binds to a receptor called as GP2B receptor. If there is a defect of GP2B receptor, just remember this much. Okay. So 2B receptor, we get a disease called as Bernard-Solier syndrome. Okay. If there is a defect of this glycoprotein 2B3A, we get a disease called as Glanzmann's thrombasthenia. That is sufficient for you people at this point, crucial point of the exam. Okay. So let's go to the next aspect. A 35-year-old patient brought into the emergency department post motor vehicle crash. For stabilization, patient needed 13 units of packed blood cells because of the severe blood loss. His vitals are temperature 96, heart rate 150, BP 90 over 40. Even with the direct pressure on the femoral artery, patient continues to bleed. Results are drawn within the first hour or pending. Which of the following is the most likely to stop the bleeding? See, very simple. He had a lot of massive bleeding. यार यहाँ पे थोड़ा ध्यान से सुनो, जल्दी आंसर करने से पहले मेरा रिक्वेस्ट है कि ध्यान से सुनो. अगर किसी का ब्लड वेसल, there is a damage to the blood vessel, he had a lot of bleeding. If there is a lot of bleeding, blood loss. So if blood loss, automatically plasma loss, automatically RBC loss, automatically platelet loss, right? All of them are lost. Okay, okay, this the answer is not a whole blood. Okay, now what we did, we gave what is that packed red blood cell, we gave what is that RBC loss was there, we gave only what RBC. Okay, but plasma is also lost, platelet is also lost. If plasma and platelet is lost, if plasma is lost, my dear students, no clotting factor. If there is no clotting factor, no clot formation. Again platelet loss, again no clotting, right? So despite of giving RBC, patient is still bleeding because of the plasma and platelet loss. So what you are supposed to give now, even after giving all of it, if it is not getting better, so even giving several severe like several, what is that, several units of the blood supply is given, but still it is not working. Very good answer. The answer is your FFP and platelet, fresh frozen plasma and platelets. ओके, चलिए ल्यूकेमिया में पढ़ते हैं. लेट्स स्टडी अबाउट द ल्यूकेमिया. तो ल्यूकेमिया, टू अंडरस्टैंड माय डियर स्टूडेंट्स, इट इज वेरी इंपॉर्टेंट फॉर यू टू लिसन टू मी फॉर द नेक्स्ट 10 मिनट्स. कुछ कंफ्यूज नहीं होना है. जो मैं बताऊंगा सीधे एग्जाम में जाना है, वही लॉजिक लगाना है, एग्जाम से बाहर आना है, भूल जाना है, तुम्हारा गारंटीड क्वेश्चन सॉल्व. जितना लॉजिक समझाऊंगा उतना ही जाना है, वहां पे लगाना है, तुम्हारा क्वेश्चन सही हो गया, बाहर निकल जाओ, भूल जाओ, बाद में अगले एग्जाम के लिए याद. Because leukemia is a vast thing to study. Now you don't have time. ठीक है, समझ में आ गया? Is that okay for everybody? हाँ या ना तो बोलो. सर हम तो अटेंडेंस डालेंगे, फिर ऐप में देखेंगे, हम रिप्लाई नहीं करते. चलो बहुत सिंपल है यार, वेरी सिंपल. We have bone marrow. In the bone marrow, we have something called as stem cells, right? Now these stem cells, my dear students, look here, we have something called pluripotent stem cell. Okay? Now this pluripotent stem cell will break into two progenitors. Remember, यहाँ पे ही दो हिस्सों में बट गया. There is two families, बंटवारा हो गया. Two families have been separated right here. One is myeloid progenitor, one is lymphoid progenitor. All the leukemia classification lies here only, either myeloid leukemia or lymphoid leukemia. Any leukemia comes in this origin or lymphoid leukemias. Any leukemia comes in this origin or myeloid leukemia. The surgery PDFs has been already shared, my dear. Please download the app. Okay, in the app, register yourself in the Meduhub app. So it's for free. I'm not asking for any money from you. Okay, download the app, install that. In there you have like live lectures and also notes. Just surf through the app, you will get it. Okay, if you are a student who is like appearing for the exam later on, for you people, we even have complete lectures for the free of cost. है ना? ओके, मैं काफी टाइम हो गया शेयर करके, आर्थो शेयर कर दिया मैंने, सर्जरी शेयर कर दिया, हर चीज मैंने शेयर कर दिया. अगर तुम्हें उससे भी नहीं हो पाता है, फिर मैं अगर मतलब मैं अपलोड करवा देता हूँ. ठीक, कोई दिक्कत. तो देखो दो हिस्से में बट गया. Two divisions have been divided, myeloid and lymphoid progenitor. Pay attention here. Any leukemia comes here, lymphoid, any comes from here, myeloid. So myeloid blast cell, myeloid progenitor will give rise to RBC, will give rise to megakaryocyte, which will further progress into platelet. It will only give rise to mast cell and give rise to one cell called as myeloblast. Myeloblast will turn itself into monocyte, basophil, eosinophil, neutrophil. So if you notice here, all the lymphoid cells come from one set, all the myeloid cells come from myeloid progenitor. If myeloid leukemia is there, all of these cells will be affected. If myeloid leukemia is there, all the myeloid cells will be affected. If monocyte is involved in leukemia, myeloid origin leukemia, basophil is involved in leukemia, myeloid origin leukemia, eosinophil is involved in leukemia, then myeloid origin leukemia, neutrophil is involved in leukemia, myeloid leukemia. खुश हो गए? If T lymphocyte is involved, lymphoid leukemia. B lymphocyte is involved, lymphoid leukemia. NK cell is involved, lymphoid leukemia. So now we understood that there are two progenitors. One is myeloid progenitor, which give rise to monocyte, basophil, eosinophil, neutrophil. So all of these comes under myeloid leukemia. Rest everything comes under lymphoid leukemia. Let's proceed. Okay. तो अब कैसे याद रखें? Sir, first and most important thing आप लोगों को क्या होता है? Look here. What is the difference between acute leukemia? First, I'll teach you acute leukemia, then chronic, easy. Okay, so let's start with the acute leukemia. Okay, acute leukemia can be how many types, my dear students? Tell me now. कुछ तो बताना चाहिए यहाँ पे थोड़ा एक्टिव, दिस इज माय रिक्वेस्ट। तब से मैंने मैसेज करो, रिप्लाई करो, मैं ज्यादा मतलब तुम लोगों को परेशान नहीं किया, अब चाहिए मुझे। Acute leukemia can be how many types? Very good. Two types. Why two types, my dear students? Because either acute leukemia can originate from the lymphoid origin or it can originate from the myeloid origin. ठीक है, तो acute leukemia में क्या होता है? The defect is maturation defect. What is that? Maturation defect. Maturation in all the leukemias, maturation defect. So if maturation defect means automatically there is an increase of immature cells. Immature cells. Increase of immature cells. Increase of immature cells. Immature cells को ये क्या कहला जाता है? Blast cells. क्या कहते हो? Blast cells. So what I'm trying to tell you is maturation defect is there in all the acute leukemias. Maturation defect is there. Immature cells will be there. Blast cells will be there. So all the acute leukemias can be classified into two types. Acute lymphoblastic leukemia. Acute lymphoblastic leukemia. And you also have acute myeloblastic leukemia. Acute myeloblastic leukemia. Got my point? Two leukemias. Okay. So if blast cell is involved, if blast cell is increased in the question, the answer should be among these two only. Sir, how to differentiate these two? Let's use a table. A beautiful table मैंने बनाया हुआ इस चीज को देखा, ठीक है? तो क्या? So CD34 is positive for all the blast cell. All the blast cell मतलब क्या होता है? तुम्हारे पास दो लुकेमिया है, दोनों के अंदर CD34 will be positive. दोनों के अंदर क्या होता है? CD34 will be positive. If I tell you CD34 positive मतलब दोनों में एक ही हो सकता है, लिम्फोब्लास्ट हो सकता है, माइलोब्लास्ट हो सकता है। मतलब for all the immature cell there is a generalized marker that is CD34, be it a myeloid, be it a lymphoid leukemia. Okay, now my dear students, all the myeloid cells will have a MPO positive. The name of the MPO means MPO means myeloid peroxidase. Myeloid peroxidase is the enzyme. It is an enzyme which is positive for all the myeloid leukemia. Remember, so MPO, all the myeloid leukemia for both acute and chronic दोनों में पॉजिटिव मिलता है। फॉर बोथ अक्यूट एंड क्रोनिक दोनों में एमपीओ पॉजिटिव मिलता है, बट ओनली कहां पे? माइलॉइड ऑरिजिन ल्यूकेमिया। मतलब इफ एमपीओ माइलॉइड प्रोजेनिटर इनमें से कहीं पे भी ल्यूकेमिया आएगा, कोई भी तरीके का ल्यूकेमिया, एमपीओ विल बी पॉजिटिव। ठीक है सर, तो आप देखना क्या है अभी? लुक हियर, ब्लास्ट सेल इज देयर, ब्लास्ट सेल इज प्रेजेंट। लुक, एमपीओ इज पॉजिटिव और नॉट पॉजिटिव? इफ एमपीओ इज पॉजिटिव, acute myeloblastic leukemia. If MPO is negative, acute lymphoblastic leukemia. Done, sir? Okay. Now look here. For example, for the B lymphocyte, CD marker is CD19. For T lymphocyte, CD marker is CD3. Okay. So remember here, for acute lymphoblastic leukemia, there can be CD19. That means B lymphocyte originating leukemia. If it is a CD3 positive means that is telling you T lymphocyte originating leukemia. Clear everybody? So with this much being said, let's do one scenario here. So there is a remember blast cell also how much percentage? More than 25% of the bone marrow. More than 25% of the bone marrow is filled with blast cells. Okay, now I will give you a scenario. I hope you understood or not, I will check that. Okay, let's see. If you didn't understand, फिर मैं इतना करने का कोई फायदा नहीं है, तो I'll at least explain you again. Okay, a child was brought to the hospital, blah 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 history. So there was a CD34 positive. Okay, CD19 negative, CD3 negative. Okay, and also MPO positive. What is the diagnosis? बस ये बताओ, देखते हैं। CD34 पॉजिटिव, दैट मीन्स व्हाट? ब्लास्ट सेल। ब्लास्ट सेल आगे तो अक्यूट ल्यूकेमिया। अक्यूट में दो ही हो सकता है, माइलॉइड ल्यूकेमिया या लिम्फोइड ल्यूकेमिया। ठीक है, अब ये कौन सा ल्यूकेमिया? विच ल्यूकेमिया इज दिस? व्हाट अबाउट अदर्स? Very good, it is originating from, very good, both of you are absolutely correct, it is originating from the myeloid origin, AML, acute myeloblastic leukemia। अब दो भाई, तुम्हें कौन सी हिस्ट्री रटेंगे, गम हाइपरप्लेसिया रटेंगे, कुछ मत रटा, कोई दिक्कत। बस डिफरेंशिएट कर लोगे एक्यूट वर्सेस क्रोनिक। ठीक है, अब एक्यूट को तो पहचान लोगे। चल, let's go to the next one। तो in now all the chronic leukemias can be divided into two types। Chronic also again chronic myeloid leukemia, chronic lymphoid leukemia। यहाँ पे क्या होता है, both of them mature cells are present, mature cells are present but their function is damaged। mature cells are present but their function is damaged। अगर उनका फंक्शन डैमेज हो गया तो क्या कहानी है? so their function is damaged। if CML is there, if CML is there, so there will be increase of what? increase of what? so CMM stand for myeloid origin। myeloid origin मतलब क्या होगा सर? myeloid origin मतलब मोनोसाइट्स बढ़ेंगे, बेसोफिल बढ़ेंगे, इस्नोफिल बढ़ेंगे, न्यूट्रोफिल बढ़ेंगे। That's it। okay, so first let's start with the CML, chronic myeloid leukemia। Chronic myeloid leukemia is most commonly caused by a mutation called as the Philadelphia chromosome। This is a translocation 922, ट्रांसलोकेशन 922। तो इसके अंदर ट्रांसलोकेशन होता है जिसके वजह से एक क्रोमोसोम बनता है, फिलाडेल्फिया क्रोमोसोम। So because of this Philadelphia chromosome, it will stimulate an enzyme called as tyrosine kinase। It will stimulate an enzyme called as tyrosine kinase। A tyrosine kinase, whatever is there, now this tyrosine kinase will go and stimulate the bone marrow। तो bone marrow के अंदर कौन सी ऑर्गेनेट को? माइलॉइड सेट को स्टिमुलेट करेगा। माइलॉइड सेट if it is stimulated, so total WBC will be increased, neutrophils, basophils will be increased। so here you can find a cells like this, I will explain about the pathological appearances later। so CML, Philadelphia chromosome, neutrophil बढ़ेगा, basophils बढ़ेगा, WBCs बढ़ेगा, even eosinophils can be increased, but what will be decreased? decrease of lymphocytes will be there because all the bone marrow is filled with myeloid cells only, ताकि lymphocyte को अभी grow होने का capability नहीं है। lymphocytes, okay, lymphocytes, decrease of lymphocyte, कहानी fix हो गया, that is CML। तो CML का बेस्ट ड्रग ऑफ चॉइस, यहाँ पे देखो पैथोलॉजी क्या है, स्टिमुलेशन ऑफ टायरोसिन काइनेस, किसके वजह से? 922 के वजह से। so if there is a stimulation of tyrosine kinase, what we are supposed to do? we are supposed to inhibit tyrosine kinase inhibitor। the drug of choice is imatinib in the treatment of CML। finished okay, imatinib okay। now once we understood about the imatinib, now let's talk about the continuation, that is where we are left with last leukemia, CLL। तो CLL के अंदर क्या देखा जाएगा? so CLL के अंदर, one second my dear students, let me just okay, CLL के अंदर क्या देखनी चाहिए? तो CLL my dear student, chronic lymphocytic leukemia। तो ये chronic lymphocytic leukemia में क्या होगा? there is a increase of lymphocytes। if lymphocyte बढ़ेगा तो कौन सी तरफ का? lymphoid origin का बढ़ गया, okay, and see why don't they give, यार मत दो यार, ना ही दिया करो, इसलिए तो मैं बोलता हूँ ना ही दिया करो। मैं अभी तक कभी यूज किया गम हाइपरप्लेस एक जगह, फिर भी मैं समझा दिया ना आप लोगों को। तो हम भी वही टेक्निक में जानी चाहिए। ठीक है, तो इंक्रीज ऑफ लिम्फोसाइट, अगर लिम्फोसाइट बढ़ेगा तो ऑटोमेटिकली मोनोसाइट ऑरिजिन सेल्स क्या हो जाएगा? कम हो जाएगा। बहुत बड़ी सिंपल है, या माइलॉइड रहेगा या लिम्फॉइड रहेगा। लिम्फॉइड बढ़ गया, माइलॉइड कम हो गया, लिम्फॉइड बढ़ गया, सिंपल बात। okay, so in this all other cells will be reduced, RBC, platelet सब कुछ बढ़ेगा, but WBC lymphocyte देखो 80% से भी ज्यादा, more than 80% of the lymphocyte, that is telling you it is a chronic lymphocytic leukemia। so if you take a peripheral smear, you get these beautiful cells here। if you notice, these are the very beautiful cell, they called as smudge cells। they are called as what, my dear students? they are called as smudge cells। so those smudge cell, if you see, this is the hallmark, of your, what is that? hallmark of your, very good, that is your, what is that? smudge cell is the hallmark of your, what is that? of your chronic lymphocytic leukemia, smudge cell। ठीक है, चलिए तो लेट्स लुक एट द क्वेश्चन हियर यार इफ आई एम हियर ना मैं तो कुछ नहीं मैं तो ऐसा क्वेश्चन देखते ही बता दूंगा फर्स्ट मुझे ना आंसर नहीं चाहिए व्हाट इज द डायग्नोसिस बताओ बस एक वर्ड देख के मैं बता व्हाट इज द डायग्नोसिस लेट्स सी come on, give it a try. In all the case scenario, bone marrow aspiration reveals 47% of lymphoblast. He is clearly telling you elevated level of lymphoblast. Elevated level of lymphoblast means acute lymphoblastic leukemia because it is 47 percentage. That is your 47 percentage. Okay. So now listen to me, what I'm trying to tell you. So remember, which of the following associated with the present presenting condition? Usually, my dear students, it is associated with the Down syndrome. This is a point to be remembered. So how did you understood? How did I understood by a 47% of lymphoblast? So you are going to get hepatosplenomegaly, okay, pallor, petechial, lymphadenopathy. These are very non-specific symptoms, okay? Got it? चलो आगे बढ़ते हैं. Now, a patient present to the primary clinic complaining of progressive fatigue, a blood smear performed, a genetic screen performed, blood smear is performed, image was given like this. Okay. Okay. Translocation 15-17, what is the most appropriate treatment? ठीक है तो यहाँ पे मैं कुछ नया चीज बताता हूँ यहाँ पे देखो my dear students you have gums. If at all gums are highlighted here, there is a very good clear cut. Gum क्या कर रहा है? Gums are doing what? They're covering the teeth. So they are telling you what is that? Gum hyperplasia. Gum hyperplasia. Gum hyperplasia. Gum hyperplasia. Now gum hyperplasia. Along with that, there is a translocation 15-17, and here inside the cell, if you look very carefully, you are finding a rod-like structure. This is not a smudge cell. A rod-like structure is found. A rod-like structure is found. So remember, this is a condition of this is called as our rods. Our rods. Our rods are a clear-cut sign of what is that? Clear-cut sign of acute lymphoblastic leukemia, ALL. It is a ALL. Sorry, AML. Sorry. It is a clear-cut sign of AML. It is a clear-cut sign of AML. AML have our rods. Our rods मिलेगा आपको M4 से. If you find our rods anywhere, if our rods are present, that is telling you that this is a positive for retinoic acid receptor. तो इसीलिए हम लोग देंगे ATRA, that is all trans retinoic acid. The answer is C. If you find our rods, the best drug of choice is ATRA. The best diagnosis is AML, but not currently used as such. The mainstay is not that. Arsenic is not the mainstay. That's the point. Okay, good. All of you are correct. So it starts from AML3. Okay, M0, M1, M2, M3, M4, M5, M6. In that, from M3, our rods will become positive. M3 से ऊपर जब जाओगे, M3, M4, M5, in all of them, our rods can be positive, but very specific to M3. Okay. Look at this one. Okay, now look at the question. Okay, a patient present with a CBC finding hemoglobin 8.5 gram per deciliter, WBC 1200 microliter, platelet is 70, platelets come ho gaya. Patient is referred for the bone marrow biopsy, which is shown the finding in the image. So finding in the image very clearly telling you our rods. If our rods are present, what is your diagnosis? Tell me the answer. I'll wait for you people. Our rods are present. Our rods present means M3. M3 is a stage of acute myelogenous, very good my dear students, acute myelogenous leukemia, AML. Got it? Okay, so this is the story of your, what is that? This is the story of your, see, those are like some unnecessary questions which I have put there. So these are the questions which I wanted you people to must know from the that is your, from your, what is the theory? From the theory of your blood, that is your hematology. Okay, so with this much being said, hematology is done. Can someone help me with on which section PDF is available? Okay. So if anybody just communicate with among yourselves. Okay. So PDFs, I think they are not specifically there. So at the video where you can find the study materials. In that you can find it, I think. Okay. All right, let's look at the blood picture. So there are some pictures of the blood which I wanted to discuss with you people. So this is a normal peripheral smear. सर peripheral smear को पहचाने कैसे? अरे पहचानना ना बहुत आसान होता है भाई, सुनो. एक होता है eosinophil, ये होता है what is that? Eosinophil. Yes, please you guys communicate among yourself, okay? And please do help each other for finding the notes, okay? Eosinophil, okay? What is that? Eosinophil. And you need to understand one more fellow, basophil. One more fellow, basophil. Okay. Okay. Now look here. If any substance, if it is eosinophil, means it will look red to orange. Red to orange. ठीक है, ये टेक्निक है भाई, ये टेक्निक है. ठीक है, it will look red to orange if it is eosinophilic in nature. If anything is basophil, that will look in which color? Blue color. That will look in which color? Blue color. Okay. Always remember rule 1. Rule is what? Nucleus, whatever is there, na? Nucleus is always basophil. Nucleus is always basophil on a H&D staining. Basophilic मतलब nucleus is always blue color. तो nucleus को भी हटा दो. Remove the nucleus also. Now you are left with what? You are left with the cytoplasm. So you look at the color of cytoplasm. Based on that, you look at the color of cytoplasm. Based on that, you divide whether it is a basophil or eosinophil or neutrophil. Understood everybody? Can I continue? हाँ जी बताओ कुछ तो. So let's start with the first cell here. If I zoom it in here, inside the cytoplasm, you can find the cytoplasm is orangish in nature, approximately slightly orangish in nature. Orange colored cytoplasm means it is a type of eosinophil. It is a type of eosinophil. ठीक है. अब देखो यहाँ पे cytoplasm and nucleus, you are not able to differentiate cytoplasm and nucleus. Completely cytoplasm is looking blue. So cytoplasm भी blue हो गया तो उसका नाम क्या होगा? Basophil. If it is between the eosinophil and eosinophil and basophil, cytoplasm देखो ना, neither it is full blue, neither it is full orange. It is between them. That is why we called it as a neutrophil. Okay, so nucleus तो हमेशा blue दिखेगा. We are looking at only cytoplasm. If cytoplasm turns completely blue, basophil. Okay, if it is orange, eosinophil. Neither blue nor orange, then it is a neutrophil. समझ में आ गया? Okay, so apart from that, my dear students, what do you have? You have the next important thing to be understood. You have your RBCs. Okay, here you have your platelets. Very small cells are platelets. Now lymphocyte, look here. Lymphocyte nucleus is bigger than the cytoplasm. Lymphocyte nucleus is bigger than the cytoplasm. Based on that, you can find out what it is. Able to follow me? Then you have your monocyte. Almost nucleus and cytoplasm are of same size. And band, matlab band cells are what? Band cells are nothing but your neutrophils only, so neutral in nature. समझ में आ गया? How to find out which cell in a peripheral smear? You got my point, my dear students? Yes or no? चलो मैं वेट करता हूँ आपका. मैं इंतजार करता हूँ तुम लोगों का समझ में आया कि नहीं आया सुनने के लिए. नो इश्यूज. मतलब अगर मैंने बोल दिया कि मैं वेट करूंगा तो मतलब जवाब बिल्कुल ही नहीं देना है. चलो let's continue. So this is a decoding of your, what is that? Decoding of your peripheral smear. Now here, my dear students, here inside the cell, you have inside the cell bluish color. Bluish color matlab anything always blue is what? A nucleus. nuclear remnant in a RBC. Nuclear remnant in a RBC is what? Nuclear remnant in a RBC is Havel Jolly bodies. All of you. Havel Jolly bodies are seen with what? Hyposplenism. Hyposplenism. Any condition where there is no spleen, automatically you will get this bodies called as Havel Jolly bodies. Got it? Okay. Let's go to the next one. So this is only your supravital stain. Supravital stain. On the supravital stain, on the periphery, the extreme most end, you are finding these bluish color bodies. They are seen with your G6PD deficiency. They are only called as the Haynes bodies. These are all directly asked previous year questions. Okay. Then my dear students, in every RBC in the center you find like a target. They're called as target cells. They're seen with which disease? Very good. Anywhere there is a decrease of hemoglobin, anywhere there is a decrease of healthy hemoglobin, you'll find the target cell, such as IDA. You can find them in thalassemia. You can find them in thalassemia. Now sir, IDA or thalassemia kaisa difference? Thalassemia, you have an increase of fetal hemoglobin and it is a genetic condition. IDA can be due to bleeding or lack of iron nutrition, or it can be associated with anemia of chronic diseases. Okay. चलिए यहाँ पे देखो, you can find this RBC. What is this RBC called as? This RBC is called as teardrop RBC. Can be seen with which disease? In the starting itself, I told you people, myelofibrosis. Myelofibrosis is a complication of osteomyelitis. Okay. Now here we have spear like, exactly like very circular spear like RBC called as spirocytes. Spirocytes are is a seen with hereditary spherocytosis. Hereditary spherocytosis. A hereditary spherocytosis is due to damage or defect of proteins of the RBC membrane. RBC cell membrane के ऊपर कई proteins होते हैं. Then there are inside the cell, in the cell membrane itself, we have some proteins called as a cytoskeletal proteins of the RBC. We call them as a cytoskeletal proteins of the RBC. Defect of cytoskeletal proteins. Cytoskeletal proteins. Cytoskeletal proteins. What are the cytoskeletal proteins we have? We have something called as ankyrin, and spectrin, and one more protein is there, band 3. If any of these three are defect, RBC will get a shape of a spear. After spear, it will undergo lysis, followed by that lysis leading to jaundice. Okay, this is your hereditary spherocytosis. Okay, let's look at this image and answer once again. Yes, this is a type of, very good, target cell. It's a type of target cell. Here you have a large RBC. There you have a large RBC. This is a type of macrocytic anemia. Here you have a bite cell. Bite cells are again seen with the G6PD deficiency. G6PD deficiency. Okay. Now, these are the type of abnormally shaped RBCs are called as acanthocytes. Abnormally shaped RBCs are called as acanthocytes. Okay, they might see acanthocytes are not specific to one particular disease. They might just give you the image and ask you what is this cell. Now here we have thin cells, sickle shaped cells. They are seen as a sickle cell. RBCs are seen with sickle cell anemia. Sickle cell anemia is a type of point mutation in which glutamate is replaced by valine, which leads to sickling of the RBCs. Clear, everybody? So this is the story of your, what is that, images associated with the blood, right? So once we are done with that, let me just quickly give you last and most important image section, that is your GIT images. Okay. So look here, my dear students. So here, if you look here, this is a very interesting image. This is a biopsy of the intestine. This is a biopsy of the intestine. In the intestinal biopsy, this is the first one, is a normal for your comparison. In the first one, you have a proper finger-like projection, called as villi, Okay. So in the second one, my dear students, this is a type of celiac disease patient. So celiac disease patient, it is gluten hyper. I'll tell you the points about celiac disease. Gluten hypersensitivity. There is a auto antibodies. The antibodies names are tissue transglutaminase antibody, tissue transglutaminase antibody, endomysial antibody, endomysial antibodies. Okay, so these antibodies will destroy the villi, and also if you look here, there will be formation of small abscesses and loss of villi. So very simple, patient with chronic diarrhea, loss of villi in the biopsy, and also this diarrhea followed by, for example, consumption of what containing food? What containing food? Gluten containing food. So after that, if they give you the history and they give you biopsy like this is an image of celiac disease. So Barrett esophagus, this is a normal lower esophagus, and this is a Barrett's esophagus. Now, if you notice here, my dear students, remember, this is your squamo-columnar junction. So if you look here, this is a part of columnar epithelium. This is a part of squamous epithelium. Now this squamo-columnar junction, this is seen with the esophagus and the stomach. Where esophagus meets the stomach, we have a squamo-columnar junction. If columnar epithelium comes here, then we are going to get, what is that? We are going to get a Barrett esophagus. Okay. Now, in the mouth, in the oral cavity, here you have a red color patch called as erythroplakia. It is called as erythroplakia. Erythroplakia is nothing but red color patch. This red color patch will be associated as a result of tobacco consumption. You might ask me, sir, only white patch, right? No, both erythroplakia and also your leukoplakia. Okay, so this will increase the risk of cancer, cancer than leukoplakia. So if I give you an option, a patient with leukoplakia will get more likely cancer or erythroplakia. Among these two also, erythroplakia patient can get more possibility of cancer. Okay, so in the oral cavity, here you have a white patch. This is a leukoplakia. Look at the history. Okay, here you have a oral candida. Here you have a oral candida, also called as oral thrush. Oral candida, also called as oral thrush. Okay. Now again, my dear students, it is a type of painful. In the oral cavity, we have an ulcer called as apethus ulcer. It is a type of apethus ulcer. Apethus ulcer. Okay. Apethus ulcer. It is usually starting after consumption of spicy food. Usually treatment is not required. If required, we can treat it with a B complex tablets. Okay. Now, if you look at this image, you can find more than 100 polyps, in the GIT. Then it is high likely a disease called as FAP. There are numerous polyps called as familial adenomatous polyposis. Now, this is called as Menentrius disease. Menentrius. This question was asked in 2019. Menentrius disease of stomach. Menentrius disease of stomach. How do I know it, sir? So I'll tell you, people. If you look at the gastric folds, the gastric fold size thickness is increased. So that is telling me what? Hypertrophy of gastric mucosal fold. If there is a hypertrophy of gastric mucosal fold, that is clearly telling you Menentrius disease of the stomach. Menentrius disease of the stomach is due to overexpression of TGF, transforming growth factor beta overexpression. So I'll write it again. TGF, transforming growth factor beta overexpression. This was asked. Okay, अगर TGF Menentrius disease क्यों होता है? Because overexpression of TGF beta. Again, this is a biopsy of the intestinal biopsy. In the intestinal biopsy, if loss of villi is there, high likely it can be due to what is that? Celiac disease. Clear, everybody? Clear? All right. So this is the story of your, what is that? Images from the gastrointestinal tract. Right? So with this much being said, we'll conclude the pathology revision session here and see you people in the next revision sessions of medicine and pediatrics. Right? Thank you. Good luck. अच्छे से पढ़ते रहो and last 5 days तुम एक consistency maintain करके रखना, करना ही करना है। आप याद होगा नहीं होगा कुछ भी हो, ठीक है, आप अपना प्लान के हिसाब से जस्ट कीप डूइंग गोइंग। ओके, नेवर अभी डर आ गया, कुछ भी हो गया, कुछ भूलने का मन लग रहा है, सब नहीं चलेगा, बस करते रहना। अब कुछ ऑप्शन, ओके, and you all will definitely pass it. Okay, all the very best. See you people in the next live session. Bye bye And all of you, it's my request, download the app and you can, like, watch all the lectures, and as well as you can find the notes. Just search around the app for 5 minutes, my dear, you can find it. Okay, and this also will be uploaded very soon. Thank you so much. Bye bye. Хорошо? Спасибо всем. Спокойной ночи или спокойной вечера. Кто-то есть там. Хорошо? Все поняли? Все понятно? Все нормально? Хорошо. Bye bye.